Testing, yeah, there you go. It was on, but it is possible that we'll have votes during the hearing, so I ask unanimous consent that the chair be authorized to declare a recess at any time. Without objection, so ordered. I want to welcome our witnesses here with us today. This morning, we will be hearing from Dr. Tracy Gordon, a senior fellow with the Urban Brookings Tax Policy Center, Dr. Jean Lambrou, Commissioner of the Department of Health and Human Services for the state of Maine. I'm going to yield to the gentleman from New York to introduce our third witness, Mr. Higgins. You want to introduce the witness?
Mark Poloncarz is the county executive from Erie County, a great county executive, a former youth hockey coach, an aspiring musician, plays the guitar, and the son of a steel worker and a nurse who worked at Mercy Hospital. Mark is a native of Lackawanna, New York. He is a source of great pride for all of us in Western New York, is a great leader with a great vision, and I'm pleased to have Mark Poloncarz here today with us.
Now yield to the ranking member to introduce another witness.
Well, very briefly, Mr. Chairman, thank you. It's a delight to have the Chief Financial Officer for the state of Arkansas in our midst today, Secretary Larry Walther, out of the Little Rock area. Obviously, you know, before the restructuring of state government that Governor Hutchinson most recently took care of, he was a Director of Finance and Administration, and Larry, you'll have to help me, Secretary now of, okay, so just added Secretary to the list, and remarkable talent and very articulate, and I think will speak well to the connections, the fiscal connections that we have between state and federal funding, and we welcome Secretary Walther.
Thank you. I now yield to the gentleman from Ohio, Mr. Johnson, to introduce our final witness.
Well, thank you, Mr. Chairman, and our ranking member, my colleague from Arkansas, Mr. Womack, for giving me this time, because this is really an honor for me and a pleasure and a privilege to welcome one of our witnesses here today, Ms. Kimberly Murnix. She is the Director of the Office of Budget Management for the state of Ohio. Director Murnix has dedicated her life to public service, and as Ohio's budget director, she works hard every day to ensure the state government operates efficiently and effectively for all Ohioans. That's what we should be doing here. She's doing it there, and that includes the roughly 721,000 people that I represent. It is great to have a Buckeye and a graduate of Marietta College, which is right there in my neighborhood. I can throw a rock and hit the president's house from my front yard. So, he's a former Marine, so he can dodge he's good at it. But we're glad to have her here testifying before the House Budget Committee. I look forward, Director Murnix, to hear your testimony and to the testimony of each of our panel members, because these issues are really important. I know they don't get a lot of media play, but they are really important. Thank you, Mr. Chairman. I'll yield back.
Absolutely, thank you. And just because it's unusual for us to have 5 witnesses, so we, in this hearing, because we wanted as much diversity as we could have, when we're talking about state and local governments, we decided to add another minority witness, and I'm glad you all are here. With that, I will yield myself 5 minutes for an opening statement. Welcome back, everyone. I'm looking forward to this new year in the House Budget Committee, and I hope you are as well. Last year, with the support of both Republican and Democratic members of this committee, Congress put in place bipartisan budgets for 2020 and 2021, complete with discretionary top lines and committee allocations, including accommodations for initiatives that are fully offset. The committee held hearings addressing some of the biggest economic issues facing our nation, including the benefits of immigration reform, the cost of climate change and aging infrastructure, the potential costs of debt, the federal government's vital role in mitigating economic downturns, and more. The federal budget has a direct impact on Americans' everyday lives, but it also affects the abilities of state and local governments to operate and serve their constituents. State and local governments touch the lives of nearly every American, and in many cases, they have been on the forefront of major policy innovation. But the reality is, many of these great advancements, like Medicaid expansion, infrastructure revitalization, and investments in our public schools, would not be possible without critical support from the federal government. From public parks to public libraries, renewing a driver's license or driving kids to school, every day millions of Americans interact with institutions and infrastructure made possible with the help of federal investments. The impact of federal funding across the country cannot be overstated. On average, federal funding makes up nearly 1/3 of a state's budget. As a result, federal funding decisions, unpredictability, and of course, national economic downturns have a major impact on states and their budgeting and their plans for strategic investments. The same is true for local governments, with many state legislatures and city councils headed into session to plan for the upcoming fiscal year. It's an important time to examine the role of federal investments in our communities. Most federal grants going to states are for Medicaid, which provides insurance coverage to 65 million Americans and allows states to customize their programs to meet the specific needs of their population. Under the Affordable Care Act, 37 states, including the District of Columbia, have expanded Medicaid, helping vulnerable Americans gain affordable and quality health care coverage. Now, Kansas is on deck to potentially become the 38th. In my home state of Kentucky, nearly 500,000 people obtained health coverage through Medicaid expansion. That's in a state of just over 4 million. I wish the people of Kansas similar success. Federal support also keeps the doors open at many community health centers and public health clinics, helping those struggling with addiction and others trying to break free from violent or abusive situations. Other federal investments that Americans rely on every day include programs that help Americans meet their basic needs, transportation projects to construct highways, transit systems, and airports, and other infrastructure investments that can revitalize communities and encourage economic growth. Meanwhile, education grants such as Title I are making sure our schools are equipped to serve our nation's youth. With the help of federal grants, localities can support their most impoverished schools and ensure students with disabilities get a full education. Using these investments, local officials can tailor programs to best meet the unique needs of their communities. These are vital programs, and while it may be easy for some of our colleagues or others in the White House to look at a dollar amount and a column on a page in the federal budget and say, yes, slash it, it's important to remember that cuts carry serious consequences for states and localities and the people we all serve. Most states and local governments operate on the thinnest of margins and would be unable to backfill any major loss of federal funding. Their budgets would take a massive hit, but it's the people, our constituents, who would suffer most. During economic downturns, the loss of federal support would be especially harmful. In a recession, states face a 1-2 punch of declining tax revenues and increasing demand for services. Federal investments help states, most of which are required to balance their budgets, to avoid painful cuts and still provide crucial services. Between 2008 and 2012, the American Recovery and Reinvestment Act and a later extension were responsible for closing 24% of state budget gaps as states nationwide grappled with the lingering effects of the Great Recession. Today, the committee will hear from witnesses who know firsthand just how important federal investments are to state and local budgets. I look forward to discussing with our witnesses and my colleagues ideas that will help keep the federal government be an even better and more reliable partner to state and local governments and the Americans they serve. And before I yield to the ranking member for his opening statement, I would like to ask unanimous consent to submit a letter from the American Federation of State, County, and Municipal Employees. Without objection, so ordered. With that, I yield 5 minutes to the ranking member, gentleman from Arkansas, Mr. Womack.
I thank the chairman for holding this hearing, and welcome to each of our witnesses here today. Late last year, we heard firsthand from experts several times right here in this room that our economy is historically strong by numerous metrics thanks to pro-growth policies enacted under this administration. A strong American economy yields positive results for all of us. From the largest state's government to the smallest local authority, everyone feels the benefits of a good economy. We are experiencing historic economic prosperity. A recession is not imminent. Rather, the true threat to state and local governments is the dire status of the federal government's finances. The federal debt recently eclipsed $23 trillion, and annual deficits are projected to exceed $1 trillion each year over the next 10 years. We may be facing a sovereign debt crisis which will affect every state, regardless of size, and negatively impact every American. When the federal government does provide support to state and local governments, federal overreach often stifles flexibility and innovation. Many well-intended federal requirements hinder states' efforts to address domestic priorities. Such requirements impose unfunded costs, hours of additional paperwork, and prescriptive measures that prevent state and local governments from tailoring programs to suit the needs of their constituents. Let me give you an example. In my home state of Arkansas, the Department of Energy gave a company called Clean Line Energy Partners a waiver to develop the Plains and Eastern Clean Line project after our state rejected the proposal. For years, the Arkansas delegation fought for our state's right to prior approval before an agency exercises eminent domain. This was a high-wire line that Arkansas did not need and did not benefit from enough to justify the amount of land and resources taken from Arkansans. Thankfully, after multiple meetings and letters from the Arkansas delegation, and under a new presidential administration, the Department of Energy terminated its contract with Clean Line. This action effectively stripped their waiver to circumvent local and state approval, placing the authority where it belongs, with Arkansans. Republican lawmakers have offered many proposals to promote state flexibility in key domestic spending priorities, such as implementing a Medicaid per capita allotment or an optional block grant and dialing back burdensome infrastructure regulations imposed by the National Environmental Policy Act of 1969. The point is that state and local governments, along with private sector innovation, are best equipped to address domestic needs. The federal government should focus on finding more opportunities to stay out of its way. The size and scope of the federal government have vastly increased throughout our country's history. The power dynamic between the federal government and state and local governments has become greatly skewed, overly dominated by federal control, and far out of line from what the Founding Fathers envisioned. Today's hearing presents an opportunity for us to have a serious conversation about the need to restore the principles of federalism in the budget process. It is in the best interest of all to promote policies that reduce the federal imprint on state and local governments and encourage these institutions to address an increasing number of our nation's domestic policy concerns. One-size-fits-all policies from bureaucrats sitting here in Washington do little to solve problems or address the needs in Arkansas's 3rd Congressional District or any other location far outside the Beltway. Today's hearing also provides us yet another opportunity to discuss the fact that the current congressional budget process isn't working. Congress has frequently relied on continuing resolutions to fund the federal government. The dysfunction and uncertainty in the federal budget process not only negatively impacts state and local governments, but it also causes significant damage to our national defense efforts. The way we're doing business today is irresponsible. While under Republican control, this committee reported a budget resolution every year. On the other hand, the Democrat majority failed to do a budget resolution last year and will not be doing a budget resolution this year. In order to truly capitalize on this historic moment of economic prosperity for the benefit of state and local governments and all Americans, we must finally come together to put our nation's finances on a sustainable path. As a former mayor, I look forward to hearing from the hardworking and dedicated state officials here with us today. Thank you, Mr. Chairman, and I yield back the balance of my time.
I thank the ranking member for his opening statement. If any other member has an opening statement, you may submit those statements in writing for the record. Once again, I want to thank all of our witnesses for being here this morning. The committee has received your written statements, and they will be made part of the formal hearing record. Each of you will have 5 minutes to give your oral remarks. Dr. Gordon, you may begin when you're ready. You're recognized for 5 minutes.
Thank you. Chairman Womack, Chairman Yarmouth, Ranking Member Womack, and members of the committee, thank you for having me here today to talk about the importance of the federal budget to state and local governments. The views I express today are my own and should not be attributed to the Tax Policy Center, the Urban Institute, the Brookings Institution, their boards, or their funders. In this short testimony, I'd like to make 3 main points. First, state and local governments are key economic players and service providers. Second, both of these roles are severely tested in recessions and other economic shocks. Third, the federal government often steps in to help state and local governments, but it could do more. On the first point, state and local governments spend $3 trillion a year. They employ 1 out of every 7 workers, more than any other industry, including manufacturing, retail, healthcare, and the federal government by a factor of 7 to 1. Since World War II, they have contributed an average of 0.3 percentage points to real annual GDP growth. States and localities fund more than 90% of and deliver nearly all public K-12 education. They undertake nearly 80% of all government spending on roads, bridges, water, and other infrastructure, not including their spending from federal funds. Together with the federal government, states administer the social safety net, including programs like Medicaid, unemployment insurance, and temporary assistance to needy families. States and localities are often hard hit in recessions. States in particular tend to rely on pro-cyclical revenues, ones that rise and fall with the economy. But state spending is countercyclical, meaning that it generally rises in a downturn because of greater demands for public programs, especially those targeted to the low income and unemployed. This mismatch creates problems for state and local elected officials who must generally balance their budgets each year. It also poses problems for the larger economy because tax increases and spending cuts undertaken to close projected budget gaps can undermine a national economic recovery. Policymakers have long recognized these potential harms from state and local budget tightening. In the 1970s, they experimented with various forms of countercyclical assistance. However, aid was often poorly targeted, slow to arrive, and not spent quickly. In the early 2000s, Congress appropriated $10 billion in one-time population-based grants to states, plus $10 billion in Medicaid funds through a temporary increase in the federal matching rate. The American Recovery and Reinvestment Act was the next major experiment with countercyclical fiscal assistance, directing nearly $290 billion to the nation's state and local governments. The Recovery Act worked faster than the 2003 bill, and many would argue it was more effective. Aid started to flow almost immediately, and it was retroactive. In addition, the Recovery Act was better targeted to places that were affected in the downturn. The federal government should do more to help prepare for regional economic shocks and help places that are left behind in the current recovery. The federal government allocates roughly $700 billion a year, or about 3.5% of GDP, in grants to states and localities each year. The federal government also helps states and localities through the tax code, allowing federal taxpayers to deduct state and local taxes and generally excluding municipal bond interest payments from individual taxable income. Federal money isn't a bailout, it's a quid pro quo. The federal government recognizes that states and localities have certain advantages when it comes to customizing programs to their populations, geographies, and costs. It wants to encourage them to spend more on valued goods and services whose benefits may extend across jurisdictional lines or that are important to all Americans. That's why the federal government has long distributed grants to state and local governments, almost always with strings attached. However, the U.S. intergovernmental grant system falls short in 2 key respects. First, federal grants do a poor job responding to divergent regional fortunes. Federal policymakers should re-examine funding formulas that may be out of step with current social and economic conditions. Examples include Medicaid, Title I education grants, highway grants, and community development block grants. Second, federal grants often are not as responsive as they could be to economic shocks or recessions. To address this problem, policymakers ought to consider making permanent and automatic a feature of the Recovery Act that allocates more money to places experiencing drops in unemployment. At a minimum, the federal government could help states and localities by reducing uncertainty associated with late appropriations, short continuing resolutions, and threatened shutdowns. It could also minimize the use of expiring tax provisions. In summary, the U.S. Federal-state local partnership did not come easily. It evolved over 200 years that included defaults, bailouts, a civil war, the introduction of new revenue sources and major social insurance programs, and lots of trial and error. It's an enduring and robust partnership, but is a work in progress. There are several ways in which the federalist system could be made stronger, especially in a crisis. Thank you. I look forward to your questions.
Thank you for your testimony. I now yield 5 minutes to Dr. Lambrou.
Great. Thank you, Chairman Yarmouth, Ranking Member Womack, and members of the committee. It is an honor to be invited to discuss how federal investments affect the state of Maine. We enter Maine's bicentennial year celebrating our strengths. This includes a good economy. Maine's unemployment rate has been below 4% for 47 consecutive months, and Governor Mills' first budget responsibly invested in healthcare, education, economic development, clean energy, and a rainy day fund. But Maine faces economic challenges as well. These include fewer workers and slow GDP growth. We are hard at work on actions to implement a recently released strategic statewide economic development plan. But we cannot do it alone. Federal grants represent 34% of the Maine state budget, above the national average. In the biennial budget, federal funds represented 58% of the Maine Department of Health and Human Services' $9.6 billion budget. As you are aware, Congress has not recently significantly changed federal funding for discretionary health and human services programs, except for opioid response. We are grateful for that funding, but urge it to be allocated based on up-to-date information on this rapidly changing crisis. We also receive federal funding for entitlement programs. The majority of federal funding to DHHS is for Medicaid, called MaineCare. Governor Mills' first executive order was to direct its expansion. The MaineCare expansion has cumulatively covered 57,000 people, providing over 16,000 mental health treatments. The program is essential to our fiscal as well as our public health. Because of this, I'd like to focus on the triple threat to federal funding for Medicaid. The first threat is congressional proposals to cap or block grant Medicaid. Last year's president's budget would shift from the federal government paying a percent of cost to a preset dollar limit. This would leave states largely, if not fully, at financial risks of high costs due to unexpected events, such as recessions or natural disasters. Maine would be particularly vulnerable to unaffordable cost shifts given its high percentage of older and low-income residents. Additionally, it is not clear whether the proposal would include the costs of recent expansions. The second threat is through executive actions that limit federal funding by constraining state options. This fall, the Centers for Medicare and Medicaid Services, or CMS, proposed a Medicaid Financial Accountability Regulation called MFAR. It would change longstanding policies on taxes, intergovernmental transfers, and other sources of state financing. CMS has told Maine that one type of tax implicated by this proposal, a $58 million service tax on providers, would have to be repealed, replaced, and returned to providers who paid it back to 2016. Even in a good economy, that would be a challenge. This may be why, unlike most rules, CMS did not quantify MFAR's impact on states. Perhaps most importantly, CMS proposes to give itself the power to make subjective determinations on what does and does not constitute permissible sources of state financing. In so doing, the proposed rule shifts the balance of powers decisively away from states. The third threat is through the courts. Republican-led states backed by the Trump administration seek to strike down the Affordable Care Act in the case of Texas versus the U.S. Should the plaintiffs prevail, the uninsured rate in Maine would increase by an estimated 65%. Maine would lose an estimated $495 million each year in federal Medicaid and marketplace funding. Uncompensated care costs would rise, straining our rural hospitals. Governor Mills signed into law LD1, which codifies the Affordable Care Act consumer protections. It would protect up to 230,000 people in Maine who have pre-existing conditions under a narrow ruling in the case. But under a broad ruling, another 360,000 people would be at risk of denial. This level of damage cannot be reversed by states. Opportunities to strengthen federal-state partnerships are also under discussion. Last fall, you heard testimony on creating federal funding formulas that would help states deliver services effectively and efficiently. For example, setting the federal matching rate for Medicaid to automatically increase with the state's unemployment rate would sustain local economies during downturns. And the House passed bill this last year will provide $200 million for state-based marketplaces, like the one that Kentucky ran that was incredibly successful until recently. Governor Mills and legislative leaders recently introduced legislation for that purpose. This would strengthen state resiliency. In closing, federal-state partnerships are essential to how we provide services in Maine and nationwide. But it indeed needs to remain that, mutual and accountable, rather than an imbalanced and uncertain relationship. Thank you.
Thank you for your testimony. I now recognize Mr. Poloncarz for 5 minutes.
Thank you. Good morning, Chairman Yarmouth, Ranking Member Womack, and to all the members of the committee. I'm glad to be here this morning to share my unique perspective as county executive on the vital role federal investments play in stabilizing America's local communities, especially during difficult economic times. First, I'd like to share a little background on the community I represent. Erie County is a microcosm of America. It has an urban core in Buffalo, many suburbs, and hundreds of square miles of family farms and rural communities. 920,000 people that live in my county, making it larger than 5 states, and is approximately the same size geographically as the state of Rhode Island. Like other Great Lake areas, Erie County struggled at the end of the 20th century with the loss of population and jobs. However, in recent years, we've seen our population increase and an economic resurgence as we have transitioned from a blue-collar economy to one based on financial services, health sciences, education, and advanced manufacturing. As executive, I manage an annual budget of $1.8 billion, dozens of departments, and a workforce of 5,000 employees. Despite having such a large budget, only $125 million is truly discretionary in nature. The vast majority of county spending is for programs mandated by federal and state government but administered at the county level. For example, Erie County is the primary provider of health and human services for the region. Programs like Medicaid, TANF, SNAP, WIC, Meals on Wheels, and so many other programs are delivered by the county. As part of the delivery of those services, the county often has a substantial local share. Erie County's share of Medicaid in 2020 alone is more than $200 million. Our departments of health and human and mental health have led the effort in combating the opiate epidemic with substantial grant assistance provided by various federal agencies. I am proud to say the Justice Department's Bureau of Justice Assistance considers Erie County to be the model county on how to respond to the opiate crisis. However, we would not be in that position, meaning more people would have died without the significant financial assistance received from the federal government. Any reductions in federal funding in the above discussed programs would have an immediate and significantly negative impact on our ability to deliver services promoting our residents' health and wellness. We have closely reviewed and monitored every budget proposed by the Trump administration, determining that many of the president's proposals would have a disastrous impact locally. For example, New York, already facing a multi-billion-dollar Medicaid shortfall, would be severely punished under the block grant system previously proposed by the president. If implemented, we would be forced to significantly raise taxes to make up for the lost assistance or cut other popular programs like libraries and parks. Furthermore, the county administers the Department of Housing and Urban Development's Community Development Block Grant Program for 34 municipalities, including our entire rural area. These grants, which require a local match, support everything from Main Street improvements to clean water projects. These grants are a vital lifeline to help our smaller communities address specific needs, just as they help the City of Buffalo build affordable, safe housing. Should the CDBG program be eliminated, as the Trump administration has repeatedly proposed, all areas of our county, urban, suburban, and rural, would be negatively impacted. Another key area that has been impacted from a lack of federal assistance is our infrastructure. Erie County owns and maintains more than 2,400 lane miles of roads. That's more than the states of Delaware, Hawaii, Rhode Island each have. Federal dollars used to play an important role in completing many projects a year. Unfortunately, with no major federal infrastructure bill in recent years, we've been only able to complete a few large projects with the limited federal assistance we received. That's why I strongly support legislation introduced by Congressman Higgins. It would provide a major investment in our roads, bridges, and other infrastructure, support good-paying middle America jobs, and will be desperately needed during any future recessions. Finally, let me give you an example of how the failure to pass the federal budget on time can have a significant impact on our local economy. Our Buffalo and Erie County Workforce Investment Board is a local organization supported by federal aid appropriated through the Workforce Innovation and Opportunity Act, WIOA. The employees of the board work with local employers and job seekers to sustain and grow our economy. However, when the federal government shuts down, those employees are furloughed as well because their salaries are paid for by federal WIOA dollars. The last thing any region could afford in a recession is furloughing the people whose job it is to help other people find jobs and employers fill jobs. This is just one small but important example of how targeted federal assistance helps grow local economies and how reducing aid or the shutdown of the federal government during an economic downturn would negatively impact a region. Erie County's economy is growing, but I can't imagine what our fiscal picture would be if some of the president's prior budget proposals had been enacted, nevertheless during a recession. I thank Congress for bipartisanly rejecting the proposed cuts in the past, and if they are included in the 2021 budget, I would urge you to reject them again. Thank you for your time, and I look forward to your questions.
Thank you for your testimony, and now yield 5 minutes to Secretary Walther for his testimony.
Chairman Yarmouth, members of the committee, thank you for the opportunity to speak to you today. Thank you to Ranking Member Womack for the invitation. I'd like to share with you a brief overview of the budgeting and planning process in Arkansas. To do this, we must go back to the late 1920s and early 1930s. Arkansas was experiencing the Great Flood of '27, a significant road debt that was transferred to the state from the counties and the overall Great Depression. As a result, Arkansas was struggling to maintain state services and defaulted on its debt. A variety of new taxes were implemented around this time to address the state's budget needs. However, this didn't solve the issue, and the state needed a long-term solution. This was established through Amendment 20 to the Arkansas Constitution. In simple terms, we're constitutionally barred from borrowing money without a vote of the citizens. Arkansas maintains a true balanced budget approach to funding state programs. We do not commit state dollars until we have those dollars in hand and available to spend. Under Arkansas law, it is my duty to see that the funds on hand and estimated to be available to each state agency are sufficient to maintain state services on a sound fiscal basis without incurring a deficit. Our annual budgeting process doesn't just allocate dollars to state programs, it prioritizes the spending. Through this process, agencies make tough decisions, but also have a clear understanding of what will take place in all the budget scenarios. Another consequence of being barred from taking on debt is our need to build fund balances in support of the most important programs. In order to safeguard state programs in the case of a recession and to allow us to remain competitive when opportunities arise, Arkansas has recently invested in a series of reserve funds. Under Governor Asa Hutchinson, we maintain 3 such funds: a restricted reserve fund, a long-term reserve fund, and a rainy day fund. Each of these play a unique role. Since Governor Hutchinson took office in January of 2015, 3 of the largest individual tax cuts in the state's history have been implemented. This includes a middle-income tax cut in 2015, a cut for low-income Arkansans in 2017, and an upper-income tax cut that became effective January of this year. These historic cuts reduced income taxes for each state tax-paying Arkansan. However, all of these tax cuts were absorbed without any change or reduction in the state services due to responsible budgeting and an economy that continues to expand. Federal funds remain a significant component of the day-to-day operation of the state services. In fiscal year 19, which ended in June of 19, federal dollars accounted for 29% of our expenditures. The largest portion, approximately $6 billion, supports our Department of Human Service, which administers the state's Medicaid program. We must also acknowledge federal funds' crucial role in addressing natural disasters and emergency. In 2019, Governor Hutchinson and President Trump declared an emergency in the state due to immense flooding on the Arkansas River. While Arkansas maintains both a balanced budget and several reserve funds that can significantly help in these scenarios, a disaster of this scale requires immediate support from the federal funds. Due to President Trump's declaration and the work of FEMA, federal funds were made available at the time and remains available today for those recovering from the damage caused by the event. I believe that the state-federal partnership is at its best in these times of need. From Washington, D.C. to those in Arkansas impacted by these events, it simply becomes people helping people. We are grateful for the decision that was made that allowed for this partnership. Before making any request at the federal level, it is up to the state to determine specifically what we hope to accomplish and the amount needed to responsibly address these needs. Understanding the importance of making this type of ask of the federal government and the state, we always carefully consider the need that go along with plus our resources before we bring them to you. Again, thank you for the honor of speaking to you today, and I look forward to any questions.
Thank you very much, Secretary. Appreciate your testimony. And last but not least, I yield 5 minutes to Director Murnix.
Thank you, Chairman Yarmouth, Ranking Member Womack, and members of the Budget Committee. I am honored to be with you here today. As Ohio's Budget Director, I serve as the Chief Financial Officer for our state under the leadership of Governor Mike DeWine. Federal funding supports Ohio citizens in crucial areas, and Ohio's biennial state budget supports these initiatives as well. To understand our budget picture, it is important to first discuss our economic outlook. Ohio's economy is strong and likely to continue expanding in 2020. Ohio's non-farm payroll employment has increased by 6,700 jobs just in November. Our unemployment rate is down. Our labor participation rate is up. Ohio manages $28 billion in federal grant funds each year, which is roughly 40% of our budget. Federal grants in Ohio are administered by 36 different state agencies aligned with federal agencies, utilizing 58 different systems and tools with approximately 800 state employees dedicated to grants administration and compliance. As Governor DeWine has said, our focus is on people, not bureaucracy. We need regulatory flexibility to address the individual needs of our citizens instead of continuing to focus hundreds of employees on simply meeting burdensome federal strings. In the 1 year and 1 day since becoming Ohio's budget director, I've been traveling throughout the state to visit with local officials. I've learned that our local governments find it difficult to navigate the grants administration process. And I'm concerned that the communities with the most needs do not have the resources to apply for grants. So Ohio is taking steps to break down these silos by creating a grants department within the budget office to coordinate across agencies. Today, I would like to share with you one example of where Ohio has cut through bureaucracy to directly improve the lives of our citizens using state and federal funding together. Our focus on multi-system youth, the children who are involved in 2 or more child-serving systems. As Governor DeWine has stated, too many families lack access to the care that their children need to be happy and healthy. For some families, this results in parents making the unfathomable choice to relinquish custody of their child to help them get the care that they need. As a result of Governor DeWine's leadership, 4 executive branch departments, 3 county-level associations, and many nonprofit organizations are now working together to coordinate care. Ohio has dedicated $31 million in new state funding, which is being used to support individual children with extremely complex needs who are eligible for federal Medicaid and Title IV funding. When combined in a coordinated fashion, these layers of funds can produce better outcomes for our children and families. Investing in our children is investing in our future, and we welcome even more federal flexibility to allow us to do even more. In Ohio, we are leading by example, eliminating burdensome and unnecessary regulations through initiatives like our Common Sense Initiative, which reviews business impacting rules, and the 1 in, 2 out rule, which requires the repeal of 2 regulations at the state level each time we adopt a new regulation. One of Governor DeWine and Lieutenant Governor Husted's main priorities is building a better Ohio through job training and workforce innovations. Ohio has more than 75 job training programs across 12 state agencies, many aligned with various federal agencies and regulations. In the past, the biggest impediment for businesses seeking to locate or expand in Ohio was our tax structure. We have addressed that. Ohio's business climate has now reached the top 3 in Site Selection Magazine state rankings, making us the top state in the Midwest. Today, our employers' biggest challenge is hiring qualified skilled workers for high-paying jobs. Ohio currently has over 65,000 open jobs that pay more than $50,000 per year. So now is the time for us to work together to streamline workforce development programs to ensure that our states can compete and win in the global economy. Many of the examples that I talked about today and that are in my written testimony required Ohio to obtain waivers from federal rules. Each waiver requires extensive paperwork and precious time that could be better spent in direct service of the needs of our citizens. Flexibility should be the rule and not the exception. We ask that you continue your efforts towards reducing the burdens so that we can maximize taxpayer dollars together. Mr. Chairman, members of the committee, thank you for holding this important hearing today and for allowing me the honor to be with you for this discussion. I'm happy to answer any questions that you have.
Thank you very much, excuse me, for your testimony, and thanks again to all the witnesses. We'll, excuse me, we'll now start our question and answer period, and as is customary, the ranking member and I will defer our questions till the end. So I now yield 5 minutes to the gentleman from New York, Mr. Higgins.
Thank you, Mr. Chairman. County Executive Poloncarz, in your introductory information, you said that the Erie County budget is $1.8 billion annually, 87% of which is unreimbursed New York State mandated spending. New York is one of only a handful of states that require counties to provide a local match, which eats up a significant portion of your revenue base. Despite this, you have become a national leader on efforts to combat opioid addiction and its associated deaths. While this is a continuing battle, continuing struggle, what is it that Erie County has done under your leadership to achieve results that make Erie County and their efforts to combat opioid addiction an outlier?
Well, thank you, Congressman Higgins, for those kind remarks. When we started realizing we had a significant crisis at the end of 2015, I brought together my health commissioner and mental health commissioner to co-chair a task force, like many other communities have done with task forces. But I told them to try everything and anything. I looked at dealing with the opiate epidemic because it was so widespread. It was affecting individuals in the city of Buffalo just as much as it was affecting individuals in the town of Concord and Sardinia, which are your rural communities, or some of our rural communities. And I tried, and in the back of my mind, I thought of what FDR did when he entered the Great Depression, which is try something, try everything, try anything. If it doesn't work, move it to the side, try again. So I've had the pleasure to work with also partners from across the country through the National Association of Counties to basically share information. This is not a partisan issue. We've come together as Democrats and Republicans to address the opiate epidemic, and what we found out is there's no one answer. It's about education. It's about medication-assisted treatment and ensuring you have more treatment availability. It's about changing prescriber guidelines. It's about getting people when they're young, because unfortunately a number of the individuals who are dying are teenagers, and they became addicted at very young ages, which you would hope never happens, but does. But it literally was, we have to try everything. If it doesn't work, toss it aside, try something else. But by all means, as FDR said, try something. And as a result, we've had significant success, but we would not have had that success without the assistance from the federal government of grants that we've received from the Department of Justice, Department of Health and Human Services, because they gave us the opportunity to try some of those things that I would not have otherwise. I would not have had the local dollars to do it if I had not received the grant opportunities from the federal government to do an opiate court. Everyone hears a drug court, but we're doing a specialized opiate court in the city of Buffalo, in which the judge or the judge's staff meets with the individual on a daily basis, as compared to most drug courts where they may meet with them on a monthly basis. We would have not been able to do that without the assistance we received from the Department of Justice's Bureau of Justice Assistance, and I thank you for helping procure that grant, which has shown tremendous success, especially when you compare it to traditional drug courts where the individual may meet with the judge or the judge's assistants monthly. It has had a tremendous success. Every death is one death too many. And I've had to attend too many funerals during my tenure as county executive, or wakes for individuals who died, including people that I know. But what we've done is we've said we're going to continue to fight this until there is no longer an epidemic. We've rolled up our sleeves. We work with our partners. It really doesn't matter what your political party is. All that matters is, are you willing to help? And if you are, can you make a difference? And that's why our community has come together to address it. And I'm proud to say that our overdoses are down. Our deaths are substantially down. There's more people in treatment, and less people are becoming addicted in the first place. And that's how you're going to end this crisis in the long run, by ensuring that less people are addicted in the first place. And a lot of the assistance we receive from the federal government has made the difference.
Just a final thought on the issue of federal investments and how they impact local communities. The recent tax cut plan, primarily to corporations, for every dollar that you give away in a tax cut, most economists, even the most conservative, say that you can hope to retain or get back about 32 cents. So the loss on investment is 68%. But if you look at federal programs like the Great Lakes Restoration Initiative, showing that for every dollar you spend, you get $4 in economic growth at the local level, the Community Development Block Grant Program, the infrastructure spending, historic tax credits, which have played a primary role in the revitalization of Buffalo and Erie County. Those are good, solid investments into the growth of the American economy, and they help county executives like Mark Poloncarz, because there are more sales tax revenues when you have growth. There are better property tax revenues as well.
Gentleman's time has expired. Before I yield to the gentleman from Ohio, As a reminder, members can submit written questions to be answered later in writing. Those questions and the witnesses' answers will be made part of the formal hearing record. Any members who wish to submit questions for the record may do so within 7 days. And as we usually do, never mind, that's all. I now yield 5 minutes to the gentleman from Ohio, Mr. Johnson.
Thank you, Mr. Chairman. You know, the purpose of today's hearing is to discuss why federal investments matter. And as the representative of rural eastern and southeastern Ohio, I can tell you, I understand the importance of providing stability and certainty to our state and local governments. But I'm deeply concerned by the premise that stability requires significant increases in federal spending or federal funding. If Congress wants to provide stability and certainty, we can start in this very committee by enacting legislation to reform the congressional budget process. In fact, I believe Congress should embrace biennial budgeting and prepare a budget every 2 years rather than every year. Director Murnix, I know biennial budgeting has a long history at the state level, and Ohio currently operates with a 2-year cycle. Based on your experience, do you believe that biennial budgeting would allow for better long-term planning at the federal, state, and local levels?
Thank you, Congressman Johnson. I do believe that federal budgeting would benefit by a more planful process. Biennial budgeting does provide that opportunity. It requires the government to look in advance, to forecast revenues and expenditures over a longer period of time, which just by definition is more planful. It would also allow states to have more certainty in what the future funding for individual programs and priorities would be. So yes, absolutely, I think that would be beneficial.
Okay, thanks. You know, there's no question that the economy is strong, and you talked about how Ohio's economy is strong, and I certainly agree with that. The economy in my district is very strong. Last month marked the 126th consecutive month of economic growth, and the national unemployment rate is at a 50-year low. We're also seeing the effects of a strong economy in our state, across the state, where we've had historic unemployment rates, historically low unemployment rates. In fact, over the last 12 months, Ohio has added 20,600 jobs, and 96,831 Ohioans found jobs, according to the U.S. Congress Joint Economic Committee. So Director Murnix, in your testimony, you mentioned that the biggest challenge for employers today is hiring qualified, skilled workers for high-paying jobs. Can you get a little bit more specific about what Ohio is doing to grow the workforce and continue the strong economy, given that we have low unemployment rates and thousands of opening jobs across the state?
Yes, Congressman Johnson, we are focused on preparing our workforce for the jobs of the future. We're looking at a program that was just signed into law by Governor DeWine a couple of days ago, is the Tech Cred program. And at the state level, that is focusing our resources and providing employers with the opportunity to upskill their workforce, to improve their skills, to gain credentials for the jobs that are in high demand in Ohio. And I mentioned in my testimony that the federal workforce development programs are spread across several different departments, and we're looking at how we can bring those together through our Office of Workforce Innovation. We are focused on the future, but more flexibility would help us to get there.
Good, good. You know, one of the things that I love about our state, we've built over time a great working relationships with our labor groups across the board, and they've been proactive in working with us on workforce development. In my district, there's a growing demand for highly trained and skilled workers, for example, in the construction trades, and many unions and employers rely on apprenticeship programs to meet this demand. Very briefly, in the last half a minute that we've got, what's Ohio doing to promote these apprenticeship programs?
We are working with employers to promote apprenticeship programs, job training programs. We have initiatives that were funded through our state budget to focus both state and federal resources on apprenticeship programs. And we are focused on areas like your district, and I'm from Southeast Ohio, as we talked about earlier, and it is important that we improve the skill set of the workers in our areas so that they can be ready for those jobs. We have open jobs in Ohio. We need the workers to fill those.
Okay, thank you, Mr. Chairman. I yield back. Thank you.
Gentleman's time has expired. I now recognize the gentleman from Pennsylvania, Mr. Boyle, for 5 minutes. I'm sorry, Mr. Boyle's gone. Now recognize the gentleman from North Carolina, Mr. Price, for 5 minutes.
Thank you, Mr. Chairman, and thank you for organizing this important hearing on the impact of federal dollars on our states and localities. I'm chairman of the Appropriations Subcommittee on Transportation HUD, so I'm naturally acutely aware of the shortfalls in housing funding across virtually all HUD accounts, and the shortfalls in our communities in terms of people who need and would benefit greatly from some support for their housing, and they don't have it. It's simply not there. So we have a couple of ways of dealing with this. The direct funding is what our subcommittee deals with, but I want to ask you today, and I'll start with you, Dr. Gordon, and ask others to chime in who have experience in this area. Today I want to focus on the tax code. The direct funding is important, and we have block grants, of course, like CDBG and HOME. They're often used as gap financing. They're combined with other funding sources. We know how important those are, and we've been able to increase them incrementally in recent years. We know we need to keep on that path. But the tax credits are less known, but maybe in some circumstances even more important. I think particularly of addressing gentrification, the kind of efforts we make in our cities to identify tracts of land, to encourage development, to bring in the private sector. My experience has been that these tax credits, especially the 9% tax credits, are extremely important. But these cities are lucky if they get one of those per year. And so the supply of tax credits, especially the 9% credits, the distribution of tax credits, as you see how this works across the country, I'd appreciate your commenting on the importance of this incentive to housing development, affordable housing development, and also any comments you have about not just the quantity, the availability of these credits, but also how they're distributed and how they work.
Thank you, Congressman. I think as an economist, the issue with any kind of subsidy for state and local governments to undertake activities that are valued by the federal government is what should the rate of the subsidy be? So you mentioned the 9% credits. I think the issue that economists would point out is that there are often other types of credits at other subsidy rates, and the same thing is true with grant programs. And for that matter, things like the home mortgage interest deduction, which are intended to spur housing consumption, there's no reason to think that the marginal tax rate of a high-income taxpayer is necessarily the right subsidy rate. So I think the concern that I would have is just looking across the board at all of these programs and trying to determine whether you are encouraging the activity in a way that you want to encourage it, and whether it's the appropriate subsidy.
But what's your experience with 9% versus 4%? Of course, 4% sounds attractive as well, but what I keep hearing is that there's a big difference, and that to really spur the kind of diversity of housing development that we need, that there's just no substituting for the 9% credits, and that they're very scarce.
Right. So clearly, having a richer subsidy would encourage more activity. I think the question is always about trade-offs and at what cost. I would refer you to some of the work that my colleagues at the Urban Institute have done, specifically on low-income housing tax credits, and thinking across the board about the mix of different kinds of tax credits and also tax incentives versus direct grants, as you said.
I would appreciate if there's particularly anything that would be relevant to the hearing record on this to refer us to this. I'm reflecting, of course, my own local experience, and I guess I'm registering the view that direct funding is not the total solution here. Never will be, probably. The HUD budget has a long way to go, but these tax credits have been a very potent instrument for encouraging diverse development. But there's certainly a shortfall in terms of the demonstrated need. Any other witnesses want to chime in on this? Yes, sir.
Hey, Congressman, all kinds of assistance is crucial, but in the city of Buffalo, historic tax credits and other types of tax credit programs have been one of the key drivers of the economic development, taking abandoned warehouses, abandoned facilities, working with tax incentives that we offer from local government to make these projects actually worthwhile because they're so difficult to do. If you eliminate those tax credit programs, you're going to eliminate a great opportunity in some of these older Rust Belt communities to take these abandoned buildings and turn them into what they are today, housing, new offices that for decades sat vacant. And if that program was eliminated, that would have a tremendously negative impact, especially on the older communities with an old building stock.
Thank you. Thank you, Mr. Chairman.
Gentleman's time has expired. And now recognize the gentleman from Missouri, Mr. Smith, for 5 minutes.
Thank you, Mr. Chairman. It's a new year, which means this committee has another chance to mark up a budget resolution. The deadline for the congressional budget for this coming year is in 91 days. I hope we can start off this year on the right track with hopefully we pass a budget resolution through the committee, through Congress. A budget provides stability, much as you all have testified. Our job on this committee is to establish a framework for the appropriators to effectively do their job. When Republicans were in the majority of this committee, we delivered on a budget every single year. And for the past 3 years, President Trump has too. But last year, under Democrat control, we didn't even attempt to produce a budget resolution. Because of failed leadership by the Democrat majority, our country is relying on a flimsy 2-year agreement that fails to provide anything close to the 10 years of certainty to a budget resolution. Now we are here today to discuss how the federal government can better provide stability to state and local governments. Looking over a report that was published last week by the majority in preparation for today's hearing, I can't say I disagree with you, Mr. Chairman. The report states, and I quote, that federal budget uncertainty is harmful to states and localities. And quote, continuing resolutions make it difficult for states to plan and implement strategic long-term investment. So taking the majority's own report into account, why hasn't this committee done its job and marked up a budget resolution? That's what we should ask ourselves. Why are Democrats okay with continuing resolutions with our government and provide nothing but uncertainty and instability to the American people? The committee needs to start doing its job. It's time we give our budget process a thorough review, modernizing a broken process that will hold members accountable. In Washington State, failing to pass a budget at least 1 month before it is due is a misdemeanor. It's impressive. And in California, of all states, their legislators go without pay if they don't pass a budget. Washington State, California. Pretty serious issues if you don't pass a budget. Where are we at the federal level? Why are we any different? Why should we not have those same kind of responsibilities or guidelines? We can do better. I hope that we do better. And I hope we get things done this year. I yield back, Mr. Chairman.
I thank the gentleman. His time has expired. And just as a comment, the ranking member and I served for the entirety of 2018 on a joint select committee on budget reform. The gentleman from Arkansas led that joint select committee with great distinction and great commitment. And we discussed many of these ideas and unfortunately could not come to any agreement on how to reform the Budget Committee. So if you have any specific ideas that, for how we can do that, I'd love to hear them.
By the way, if the gentleman will yield for just a brief moment, for the record, let it be known that the chairman of this committee, John Yarmouth, was a yes vote on that budget process reform proposal, and that's not a small undertaking. There were 2 members of the party that voted in favor of those proposals, and the chairman is one of those. So I think, in defense of the chairman, he gets it. He understands that this process is broken. I think everybody on this dais would probably agree that the process is broken. The solution as to how to fix it, though, is somewhat elusive to the Congress right now.
I thank the gentleman for his comments, and I would just make one more remark to the gentleman from Missouri. Anybody who expects to have certainty for 10 years in today's world is badly mistaken too, I think, or is wildly optimistic. I now yield 5 minutes to the gentlelady from Illinois, Ms. Chakowski.
Thank you, Mr. Chairman. Climate change is the greatest challenge facing humanity today. This is, just this month alone, we saw headlines that said, quote, Earth posts second hottest year on record to close out our warmest decade. Another Australia fires push some species to the brink of extinction. And another floods exacerbated by climate change could destroy Venice. So it's worldwide. And I've seen the effect even in my own community where the levels of Lake Michigan are at almost their highest level. We saw flooding of Lakeshore Drive in Chicago and severe damages around the lakeshore. I hope I pronounced it right. Mr. Polenkars, is that correct? Good enough?
That is correct.
Okay, good. Last year, you reaffirmed Erie County's commitment to the Paris Climate Agreement, with Erie County government already reducing its greenhouse gas emissions by 28%. And Buffalo was even designated as a climate-smart community. So I want to know, how did the federal government and investment help Erie County in its effort to reduce greenhouse gas emissions, and become a climate-smart community?
Well, Congresswoman, there's no easy answer to that because there are so many different ways of going about it, by ensuring that there are appropriate assistance and credits to remove from a coal-based economy, a carbon-based economy, to a clean economy. We've used, and developers have used historic tax credits to take advantage of building new wind farms and solar farms. We proved through my county that you can actually meet the standard of the Paris Agreement. We met it years before was the expectation you were supposed to meet it, and we continue to see a reduction in greenhouse gas emissions. One of the things that's been very helpful is the assistance from the EPA to create what's called a Sustainable Business Roundtable, in which our business community has taken the lead and said, we want our businesses to succeed, not just thinking about 2, 3, or 4 years from now, but 50 years from now. And so they're using assistance that we've received from the EPA to create a Sustainable Business Roundtable to assist local businesses find ways to make themselves more sustainable, to use, of course, less fossil-based fuels, but also less water if possible, because while we live in an area in the Great Lakes that has a substantial amount of fresh, clean water, we've also seen significant problems with that fresh, clean water. All you got to do is ask my friends from the other side of Lake Erie about what's going on with the algae blooms and how they had to actually stop drinking water.
That was actually on the front page of the Chicago Tribune, a picture of the algae bloom, yeah.
I lived in Toledo. I went to the University of Toledo College of Law. I know the area very well, and I can't believe a city and a community that large has basically said you cannot drink the water from the municipal system anymore because of the harmful algae blooms. We've worked very hard to find different ways. There's no easy answer, but it does take a government coming to the lead and saying, we will help others reach the potential that they can when it comes to reducing their carbon emissions. And we've proven it. And the good thing in our community is our business community has stepped up to the plate and said, we want to play a part as well.
So what would be the impact on your community's efforts to address the problem? If federal funding for the Department of Transportation, Housing and Urban Development, or Environmental Protection Agency were cut, as has been proposed by President Trump?
Well, it would be substantial, Madam Congresswoman. We know that the largest portion of greenhouse gas emissions in Erie County right now is directly related to transportation costs. So anything that we can do to take vehicles off the road and to replace it with trains and other types of processes and transportation that is actually not using carbon-based fuels is going to make a big difference. Community development block grants have a huge impact even in smaller communities. A $100,000 grant to a small town or village in our rural areas could have a huge impact on actually their entire budget. And if you take that away, they lose the opportunity to take actions to create a cleaner, greener community like clean water projects.
I thank you for that, and that multifaceted support from the federal government is so important. Thousands of experts are warning that climate change could make large parts of the earth uninhabitable, and it's critical that we invest in preparing communities for their demographic changes and fighting to save our planet. You're doing a great job. Thank you very much.
Gentlelady's time has expired. I now recognize the gentleman from Texas, Mr. Flores, for 5 minutes.
Thank you, Chairman Yarmouth. I'd like to thank each of the witnesses for being here today. By any number of metrics, our economy is really strong, thanks in large part to the policies implemented by Congress in 2017 and 2018 and by the Trump administration. The U.S. economy is in the midst of its longest period of uninterrupted growth in American history. I'll illustrate this by quoting from Jerome Powell, the chairman of the Federal Reserve Bank, who stated at the most recent Open Market Committee meeting, quote, "Wages have been rising, particularly for lower-paying jobs. People who live and work in low and middle-income communities tell us that many who have struggled to find work are now getting opportunities to add new and better chapters to their lives. This underscores for us the importance of sustaining the expansion so that the strong job market reaches more of those left behind," unquote. I couldn't agree more, but the truth is that the real barrier to successful state-run programs that serve to sustain this current economic expansion is not the lack of federal funding. Rather, it is burdensome federal mandates that deny our states the flexibility and ability to innovate. So in this regard, in fiscal 2018, federal spending on major healthcare programs totaled $1.2 trillion. About $380 billion of that was spent on Medicaid. As all of us know, there are several guidelines and requirements that states must abide by when spending federal Medicaid dollars. So my questions are these. And I'd like to direct these questions to Secretary Walther, Director Murnix, and Dr. Gordon, I think you mentioned the flexibility challenge also. So the first question is, are there any reforms that Congress could consider to give states more flexibility in designing and executing healthcare programs so that they are better tailored to the needs of local communities? Secretary Walther, we'll start with you.
First, I'd like to say that we're very pleased with the amount, the way it's working. Generally speaking, it's a critical part of our budgeting process. In order for us to plan on a biennial basis like we do in Arkansas, it's imperative that we have an idea of what that support from the federal government will be over the next 2 years. Having said that, there are some areas where it is problematic. There's a process, it's called the FMAP process, where it's the state's relative proportion to the rest of the United States, and it's a wealth index, so to speak. And that changes from time to time, and it changes the amount of money that is supported by the federal government compared to the state government. It's a percentage number. It's around 80-20, say, or 70-30, I mean.
If I can stop that for just a second. So the answer is yes, you need more flexibility.
Yes, flexibility.
Let me ask you to supplementally give us more information on that, if you don't mind,
Yes, sir,
so I
I'd be
can
glad
get
to.
through the rest.
Sorry.
That's very helpful. Director Murnix, tell us about, does your state need more flexibility in this regard?
Congressman Flores, absolutely. Ohio currently, just in the Medicaid program, we have 18 different federal waivers. There are 450 plus Medicaid waivers in place throughout the 50 states. And I think the magnitude of the waivers illustrates perfectly the restrictions that we're under, that we need waivers and all of the paperwork and all of the
Sounds like
bureaucracy that goes with it.
Sounds like we're onto
Just-
something here, so if you could supplementally give us more information on that.
Yes.
And Dr. Gordon, did you mention something about the need for flexibility when it came to state funding as well?
Well, I was actually thinking of Medicaid as an economic shock absorber. So the fact that the Recovery Act added an increment in spending that was tied to local economic conditions, I think is something that could be made permanent. So there's more certainty for state and local officials if they see a big increase in enrollments as they did at the beginning of the Great Recession.
Okay, great. Let me go to the next question. I think this is important. I think all of you touched on this. As you know, the federal budget process has been broken. There hadn't been a budget passed in the last several months. And then the federal funding was on again and off again, and we had CRs. Can you please describe the practical impacts of Congress failing to budget and appropriate funds on time in terms of making it difficult to plan and implement your state budget? Let's start with Director Marnix.
Yes, thank you,
Real quick
Congressman.
question, real quick answer.
Yes, it makes it very challenging. When we came into office, when Governor DeWine came into office 1 year and 1 day ago, we were in the midst of a federal government shutdown.
Right.
And that made it very challenging. We can, for a period of time, keep our programs operating using state resources, but that the time and effort dedicated to keeping everything going so that Ohio's economy and our employees and our staff can have stability is extremely challenging.
Thank you. I'd ask the rest of you to answer supplementally if you don't mind after the hearing. Thank you. I yield back.
Thank you, gentlemen. Time has expired. I now recognize the gentlelady from California, Ms. Jayapal, for 5 minutes.
Washington State. But I was going to say to my colleague from Missouri that he could always move to Washington or California, and we have Democratic legislatures and governors in both states. So thank you very much. I wanted to start by just saying that federal government spending is essential to a real partnership between states and local governments and the federal government, and critical to our ability to really bring our 50 states together and support that partnership. We had a budget hearing recently that the chairman pulled together that was around with economists, and we talked about the failed austerity measures that have been shown through research to really hurt our country and to hurt our people, and certainly to hurt state and local governments. And so I wanted to start there and perhaps direct this to Dr. Gordon and Dr. Lambrou. The past federal government austerity spending times, can you give us a sense of how they have affected state and local governments in a broad way? Dr. Lambrou, perhaps specifically with your portfolio. You want to start us off, Dr. Gordon?
Sure. People who look at the state-federal partnership often talk about these ages of federalism. So for a long time, the federal government and states basically operated independently of one another in this sort of dual federalism. Then there was an era of cooperative federalism where the federal government was expanding its role, but still recognizing the strengths of state and local governments, delegating about 9% of its budget to those governments to carry out important functions like social services and public works. Then you saw a period of a sort of proliferation of federal grants, some retrenchment from that, consolidation of grant programs, and then an era of a decline in real per capita grants going to state and local governments in the 80s. That's rebounded. State and local governments are now getting on, as a whole, about 25% of their revenues from the federal government. There are a lot more creative uses of federalism, things like Race to the Top during the recession, where the federal government leveraged funds to get state and local governments to make certain investments in things like information technology. So there have been these various eras of federalism. It has changed throughout the years. There's nothing to say that we're in the right place right now, but I think we're learning from these experiments, especially things that are undertaken sometimes during hard economic times, as you mentioned.
Dr. Lambrou, you oversee a very important portfolio, safety net portfolio. Tell us what happens when the federal government cuts back, particularly in times of recession, but really in both instances of growth and recession.
Sure, and while I can't speak quite to my experience in Maine in the last year, since our economy has been good and the federal government has not yet cut back on funding, Looking back, I was in the Obama administration when 2009, 2010 hit. And so we worked hard to figure out with our state partners, how do we support Medicaid federal financing percentages increases to target to unemployed states, or excuse me, states with high unemployment. But I would say we thought at the time if we could make it permanent, then you would actually end the uncertainty. Fast forward, in the state of Maine, we do have a Medicaid contingency fund in case, because we need to. We do think through, if there is a downturn, do we have enough money for TANF and the low-income supports? And we have to do that within our own means because there's not the automatic stabilizers that Dr. Gordon talked about. So we would prefer to be able to use the money we have effectively to implement programs on the ground and not have to set aside money as much as we do because there's not the automatic response that the federal government is going to be there for us.
Thank you. I want to go back to housing and homelessness. This is something that our communities across the country are struggling with, and we do have a lot of tools at our disposal, including McKinney-Vento funds, CDBGs, low-income tax credits, and of course HUD vouchers and public housing. Mr. Poloncarz, could you talk to us? You called community development block grants a vital lifeline that help communities develop affordable housing and infrastructure. Tell us more about why those funds are so needed in your community and how you've used them.
Well, when we think about community development block grants, they can range from very large affordable housing projects in the city of Buffalo to, as I previously said, clean water projects in a small little rural community where we may be assisting them to do repairs on a sewage treatment facility. And it's the kind of things that people don't necessarily think about government doing, but they want government to ensure that it's there. And so when you talk about housing, every community in the United States has a homeless problem. Thankfully, our community doesn't have as much as some other areas. Maybe it's because people just, it's tough to be homeless in Buffalo in the winter. But we've had individuals die outside during winters when they didn't have appropriate housing. We have homelessness and issues associated with individuals in our rural community, just like we do our cities. And if we don't have the funds to help provide assistance, not just through the county, because remember, the county sometimes is also a pass-through to a third-party not-for-profit that is actually delivering the actual service to the individual or the family. So if we were unable to do that, if there was a shutdown or there was a slowdown or there was a cut in those programs, we, the county, now have to make a determination, are we going to use our own funds? And remember, out of my $1.8 billion budget, only $125 million of that is is discretionary. The rest is all mandated. So then I have to make a determination, am I going to cut other programs or am I going to raise taxes for this service, which the vast majority of the public doesn't even understand we provide. And that's why it's important.
Thank you, Mr. Chairman. I yield back.
Gentlelady's time has expired. I now recognize the gentleman from Texas, Mr. Roy, for 5 minutes.
Thank the chairman. Thank all of the witnesses for coming in and taking your time out to be with us here today. I've been intrigued by some of the language that I've heard here today. A lot of my colleagues like to use the word investment. It's one of those euphemisms that always gives me a little bit of a smirk about where that dollar's coming from. Heard a lot about partnership between the feds and the state. Heard here about failed austerity. Well, I would agree with failed austerity because we're sitting here with $23 trillion of debt piling up around our ears for our kids and our grandkids. So yes, any kind of effort at austerity has indeed failed. We are currently racking up roughly $110 million of debt per hour. So during this hearing, congratulations. We're going to rack up another $220 million of debt. That's what's happening as we speak. Those are the real numbers. That's what we're facing. So what I'm curious is I look to my folks here testifying from the perspective of states. I worked in state government. I was the first assistant attorney general of Texas. Worked at the Texas Public Policy Foundation focusing on federalism issues. I appreciate that states are here. I think my question is when we're looking at states, my question, for example, from the gentleman from New York, Mr. Poloncarz, is there any federal restriction on the ability of the state of New York to raise taxes or come up with revenues to produce whatever the state of New York wants to do?
I'm not aware of any federal restriction. The local governments in New York are under a 2% tax cap restriction.
By the state of New York?
Correct.
Right. So the state of New York makes its choices about what it wants to do with respect to taxes and how it wants to spend its money without any interference from anybody in this body. Is that correct?
I'm not aware of any restriction on how many taxes we can raise as a result of a federal
How many
program.
million people live in New York State?
Well, well, that varies, but there's approximately 1 million in my community, and I believe there's about 18 million, I think, in New York State. It's a urban, suburban, and rural from.
Might be a little bigger than that, but okay, so there's a lot of people in the state of New York. It's a full functioning economy. They're able to produce revenues for the state of New York by virtue of taxing their citizens in the state of New York. I think my question would be is why are 300 people a day moving away from New York City and the tri-state area? Why are 300 people a day flocking away from that area and moving to, for example, in Texas, where we have 1,000 people a day moving to Texas? I would suggest because of the laboratories of democracy, we're able to see that individual states are able to create systems and create environments in which they think will create prosperity and growth and economic opportunity, and people are flocking in droves to those places that are seeking to create an environment where you can have economic growth and opportunity. I would ask if Mr. Walther, the gentleman from Arkansas, if you might agree with that rough statement that I just made.
Generally, I would. Obviously, there are a lot of things going on in Texas, no income tax on personal income, things like that. Weather, probably a weather difference, but Texas has become quite a state when it comes to technology and has brought a lot of people in. We compete with Texas also in Arkansas, so I've seen it from a little north of you.
Yeah, yes, sir, you do indeed. We can talk a little football, but we haven't had much to talk about lately in either state. But here's one thing I would note. I mean, I'm just looking, I pulled up a CNN list here. New York comes in #1 in the overall taxation burden on its folks. Well, I guess my point here is we've got folks here talking about how important it is for these programs for states to get money from the federal government. Well, there's no more room in the inn. We have $23 trillion of debt, $100 million of debt an hour. I think if the states are looking to the federal government to be fiscally responsible and to solve your problems and to create the programs that you want for the citizenry, well, you should go a different direction. States need to come up with ways to solve their own problems. States, when they do that much more effectively than people governing from Washington trying to make decisions for 330 million Americans. Right now, the state of Texas loses almost $1 billion a year in dollars that we put out for transportation dollars for the dollars we get back. State of Texas has a lot of transportation issues. I'd like to get that money back. I'd like the dollars to stay in the state of Texas. I'd like the federal government to focus on the one thing it should do, which is securing the United States. Texas deals with the burden of a broken border, where we have 900,000 people who have been apprehended in the last year, in the last fiscal year, coming into heavily Texas. When is this body, this Congress, going to do its job, its constitutional duty to defend the United States of America, secure the borders, so that Texas and border states don't have to bear the burden of a failure of this body? When will this body embrace some of the reforms we've talked about here today to be responsible? And when will states recognize that coming to Washington for more money is ignoring the very responsibility of states to do what they do best, which is take care of people at the state and local level? I thank the chairman.
Gentleman's time has expired. I now recognize the gentleman from New Jersey, Mr. Series, for 5 minutes.
Thank you, Mr. Chairman. You know, over the years, I put together a few budgets. I've been a mayor, I've been a speaker of the New Jersey Assembly. So I think a few budgets have come along my way. And talking about uncertainty, I think that's obviously one of the biggest problems, especially at the local level. You know, you do something today, and they talk about all these cuts, and it's gone tomorrow. Examples like the COPS program. You hire cops, next year it's gone. Then we pass things in Washington requiring certain uniforms for fire departments and certain things. That's a lot of money that comes in. And small communities want to buy a pumper. They say $100,000. That's not to mention a ladder truck that is so expensive. So when we talk about uncertainty and partnership, the government certainly has a role to play because communities just cannot handle these kind of things for them to be secure and be safe. So when I hear all these cuts, CDGB program, you mentioned it, sir. You know, I mean, that's the lifeline of communities. You know, and not to mention charity care for hospitals. I mean, I could go right down the line of some of the things that when they talk about cutting, that puts pressure on the local individual who's already overtaxed. And not to talk about infrastructure. You know, in New Jersey, we have this tunnel that we need to rebuild. The Northeast region produces about 20% of the GDP of this country. We have a tunnel, we have two tunnels, 100 years old. We have a bridge that is the lifeline of these tunnels, of the commuter, that is over 100 years old and it doesn't lock properly. You need somebody with a sledgehammer to line it up properly. I don't think people realize the impact that if these things go, that is going to have on the entire country, because the region just generates so much money for the government. New Jersey, New York, Connecticut, we are all sending states in terms of sending money to the federal government. And we don't get money back like we send. I think New Jersey, I think it's what, 28% what we get from the federal government. So, I'm a firm believer of this partnership with certainty, if we can bring it to a degree. We talked about tax credits. Everybody talks about affordable housing. But the only way that you can build now, not just affordable housing, but senior citizen housing, is through tax credits, because there's very little money. So if you take away tax credits, where are these communities going to find money to build a senior citizen building? If you take away all this money, it falls on the lap of the community that does not have that money. So there are certain government programs that are certainly needed for communities to be able to deal with the situation. I come from a very urban district. The town that I live in, I always say this, is 1 square mile, and it's got 52,000 people in it. I represent Hoboken, New Jersey, 1 mile square, it's got about 53,000 people in it. Not to mention Jersey City, which is going to become the largest city in New Jersey with the next census. So these urban areas are under more pressure than some of these other parts of the country, and they need more. Unfortunately, that's the reality of it. They pay more, but they need more. So when we talk about cuts, and quite frankly, some of the legislation we pass here, sometimes the impact on these communities, it's really tough. So all I can say is a partnership is necessary to get some of these projects through, to continue to generate income for the federal government. If you stop people from commuting into New York, you're going to lose money in the long run, because New York is the engine that generates a great deal of money that goes to the federal government. I guess I don't have a question, but I just give you a rant and rave here for going through so many years of putting budgets together, but it was never easy, believe me.
Gentleman's time has
Like that
expired.
project.
Gentleman's time has expired. I now recognize the gentleman from Georgia, Mr. Woodall, for 5 minutes.
Thank you, Mr. Chairman, and thank you for holding the hearing. I appreciate you all being here. Mr. Poloncarz, you referenced transportation infrastructure spending. I serve on the Transportation Committee as well. We actually don't have any problem spending the money. It's raising the money that we have a problem with. Fourth quarter of last year, federal government spent $1.16 trillion. That's a 7% increase. We brought in a little over $800 billion. That was a 5% increase in revenues. But you do that envelope math, you find out we spent about 43% more than we brought in. And I'm guessing any of your jurisdictions, if we freed you up to spend 43% more than you're bringing in, you'd be wildly successful too. So what I want to find out from all the local expertise is, you've talked about flexibility, which is taken away when money comes from the federal government. You've also talked about uncertainty, which is created when the federal government hits our speed bumps. When we talk about block grants in particular, we're trying to create some certainty here. I don't think anyone would deny in a time of recession, in a time of natural disaster, as many of you mentioned, there's a huge role for the federal government to come in and help our localities. But that's not where we are right now. Today, while the federal government's spending 43% more than it's bringing in, we're at a time of great economic prosperity in our localities. So you tell me why now isn't the right time to have some of these block grant conversations that creates federal government budgeting certainty, and stipulating that in those times of recession, in those times of crisis, the federal government will need to step up and be a better partner. Can I start with you, Dr. Lambrou, because we brag so much about your risk pool there in Maine, and there's so much that we can learn from your jurisdiction, from Mr. Paul Carr's jurisdiction. Tell me why now isn't the right time for us to bring some federal certainty.
So I would argue that knowing at the state level that if there is some unexpected costs, and recessions are one source of that, they're not the only one. So for example, we know that about a decade ago, a new drug came onto the market that cures hepatitis C, cures it, but very expensive, without having some ability to have some additional federal funding to match, not to just 100% pay for that new drug, but to match it was important. Louisiana had Katrina, their population increased, natural disasters is a cause. So we have multiple reasons for
stipulating that all of those things are true. If I agree to be a good federal partner with you on those unexpected occurrences, why is it unreasonable to ask you to be a good state partner to me by giving me a certain expenditure for normal expenditures? For right now, the skin in the game is just out of whack. We saw it in Georgia where we created a provider tax to say, well, we'll just have a provider tax. That way we'll get 2/3 more from the federal government than what we were getting from them before, right? We're all clever folks at gaming the system where we rob banks because that's where the money is. I want to be a good partner, and we're not now, and that's why you all came to town, because we're not a good partner to you when we get into federal government shortfalls. But if not today, when is the day to have the conversation with my state and local partners about capping my federal government involvement in your communities during a time of normalcy? Dr. Gordon pointed out that 90% of education in my community and your communities is funded by you all, and yet my Board of Education spends a lot more time talking to me about federal restrictions than they do talking to local families. Secretary Walther, Arkansas and Georgia, we've got a lot in common with one another. I don't want to be a bad partner. I don't want to shirk my responsibility. I just grow weary of, if only the federal government was doing more. Well, I'm doing so much more that I'm doing 43% more than the revenue that I'm bringing. And guess what? When I go to get that 43% of the revenue, it's going to be high-income jurisdictions like New York. It's going to be successful jurisdictions like California. The taxpayers are going to be the taxpayers. Mr. Secretary?
One observation from what you were saying is right now we are at a certain place in the budgeting process where the states and local governments are receiving a fairly known amount. If we start making dislocations of that, it may on a large basis be not mean anything to you when you're looking at it from the very top, but if you're at the bottom where the money actually gets distributed and affects the citizens of a community, and they lose that, it could be devastating. So it's important that we work together, that we look eyeball to eyeball and you understand our issues and we understand yours, and we work out a solution. That's the way it has to be done.
The chairman knows from our work on the Joint Select Committee last cycle, there's a shared understanding that the piper is going to come to be paid, and those folks that you point out, Mr. Secretary, that can handle that dislocation the least are going to be the ones who are affected the most when that day comes. And I just don't want us to miss this opportunity at the top of the economic cycle to solve some of these problems. I appreciate your indulgence, Mr. Chairman.
Absolutely. The gentleman's time has expired. I now recognize the gentleman from Virginia, Mr. Scott, for 5 minutes.
Thank you, Mr. Chairman. Do you have the charts? Thank you. These are just a couple of charts. We've heard all about the, is it going to fill in? you go to the next chart? Well, let me go back to this. With this, if it was filled in, can you go back one? If it was filled in, it would show the last 3 years under Trump is 189,000 jobs per month. Under the last 3 years of Obama, 224,000 jobs. And you could see in the jobs, when the Obama administration proposal went in 2009, we were in the bottom. We were losing a lot of jobs, and we recovered. And you'd also see that there wasn't a wrinkle when the Trump administration proposal went in. Next chart. This shows the unemployment rate. At the top of the worst unemployment was the Obama administration economic proposal, and as you go down, you don't see a wrinkle anywhere to suggest that the Trump administration had anything to do with it. And the final chart shows that going back in the Nixon forward, every Republican without exception ended up with a worse deficit position than he went in with, and every Democrat without exception ended up with a better deficit situation than they started off with. You know, just to get, as we discuss who's getting credit for what, we just like those on the table. Thank you. Ms. Lambrew, Maine expanded Medicaid, 43,000 people got insurance. Can you tell us what effect that had on the state budget?
Sure. We are in the process of doing that kind of quantification. It's just been about a year, but we expect that in the 2-year budget cycle that we operate, that we will be able to get over $700 million more in federal funding to invest in opioid use reduction treatment. For example, 1 out of 10 expansion enrollees has gotten some treatment for opioid use reduction. 16,000 people got mental health treatment in the last year. Over 3,000 people got a cancer screening, which we think will have a long-run savings to the state and the federal government as people get care detected earlier. We also know our hospitals are beginning to experience declines in uncompensated care, which at the end of the day is good for all citizens as private premiums come down with less of a cost shift in the state. So we're quite excited about the early results of our Medicaid expansion.
What about state revenues with all the additional spending? Are you getting any additional revenues, tax revenues?
So we don't single that out again. I can say generally that the revenue forecast for the state of Maine has been good. It got revised upward in December, so the revenues in the state of Maine are strong at the same time as the Medicaid expansion.
So the expansion got in more federal money and probably increased revenues as a direct result of expanding Medicaid and covering 43,000 people.
There was certainly no decline in revenue. At the same time, revenue was going up in that period. And I will note, going back to what happens in a bad time, the Medicaid expansion is exactly the right policy. You want to have an effect because that's covering, as one of my colleagues said, the working poor. Should they lose their jobs, they could, without the Medicaid expansion, lose their health care, put strain on hospitals, put stress on local communities. With a 90% federal matching rate for that group that's most vulnerable to expansions, I would argue is one of the better recession-proof policies that we have in the state of Maine.
Thank you. Secretary Walther, you mentioned your levee situation. Have you, and obviously if you have better levees, when storms come, you'll have less damage. Have you projected whether or not the cost savings and reduced damage due to the levees would be more than or less than the cost of constructing the levees?
No, sir, I do not have that information.
Do you, is there any way that you can build the levees without federal support?
There is. It'll take a lot longer period of time, but I'm sure it would be possible. A lot of that is done through local levy boards that work to generate revenue on a local basis to complement the money we get from the federal government, too.
Okay. Ms. Gordon, you mentioned some of the things that we can do, counter-cyclical spending. We have counter-cyclical spending with food stamps and unemployment benefits. What should we be doing before a recession starts so we'll be ready for a recession?
Thank you for the question, Congressman. I think that people often talk about automatic stabilizers in the tax code, federal tax burdens that go down automatically when people earn less income, or social safety net programs, as you mentioned. But I think one aspect that gets overlooked is this countercyclical assistance to state and local governments, which, as the Congressman mentioned, do have skin in the game, and they are providing these services as soon as they are demanded. There's not always necessarily a backstop from the federal government.
Gentleman's time has expired. Now recognize the gentleman from Pennsylvania, Mr. Muser, for 5 minutes.
Thank you, Mr. Chairman. Thank you all very much for being here with us today. We are certainly experiencing quite an economic boom. Economic booms, job creation is the #1 revenue generator for governments. The economic boom is due to a number of things, but the primary factors are certainly a less regulated economy. Without a doubt, the tax cuts. I think the tax cuts exceeded anyone's expectations, even the highest of expectations, by putting more money in people's pockets and in small business and in large businesses that employ millions, of course. Those companies are reinvesting, and people have simply more money to spend how they see fit, and the multiplier effect takes place, far more effective than any targeted spending, stimulus type of spending from the federal government or any level of government. Trade is a huge factor. It completely opens up new markets for our best products in the world, our made in USA products and farm goods. Low interest rates play a very big role, and that's the case. And having low cost and dependable energy at our disposal, which is not affected by geopolitical Middle East and military events. So anyway, we also have something known as the 10th Amendment, where the power is not delegated to the United States by the Constitution, nor prohibited to it by the states, are reserved to the states and to the people. So all that being said, I use a very simple example. Think of your traffic lights in your hometown. Imagine your federal government was in charge of your traffic lights. First of all, if there was ever a problem, it would take a while for them to get fixed. Whether or not they worked right or not would be relatively up for grabs. And they always seem to work extremely well. So thank goodness we're smart enough to have where the funding takes place for such things as close to the scene where it's needed as possible, where the proverbial rubber meets the road. I was Revenue Secretary for the Commonwealth of Pennsylvania for 4 years, and in one of our budgets, we initiated block grants to counties. The block grants, depending upon the funding, were anywhere from a 15 to 20% reduction from the previous year. Initially, there was a lot of squawking. How can we do that? Then we asked the counties what they thought. 66 out of 67 counties felt they could do a far better job with anywhere from 15 to 20% less from the state government, and it worked out very well. So I'm going to ask you about block grants related to Medicaid, certainly education, transportation, and under Obamacare, there were some waivers given, of course, to states related to health care. So, Mr. Walther, I'll start with you. What are your thoughts on the effectiveness of federal block grants to the states?
From our point of view, they are much easier to administer and to get the dollars to those who need it. In other words, we get a block, and then we determine on a local level where those dollars go based on the requirements that the block grant actually has in it. So it's a great way of doing it. And some places we get that, and some we don't. But it would be a preference, I guess, from the state's point of view. The more we can do that, the better it is in administering and getting the dollars to those who need the money.
Great. Ms. Mrniak, related to Ohio, in your experience?
I would concur that the more flexible we can be in our funding and how we are able to dedicate the funds to the important programs that are going to have the biggest impact locally, the more flexibility that could be provided in that, whether it's through block granting or another methodology, would be appreciated in Ohio.
Great, thank you. And let me ask you this, and Ms. Mrniak, while you're speaking there, what does the federal government do well for Ohio, for the states? What kind of synergies, what funding initiatives and cooperative efforts are effective and not only appreciated, but deliver a good return on investment?
Well, I can say that when we look at the Medicaid program, overall, that has enabled us to address the opioid addiction program and the drug problem that we have had in the state of Ohio. I would say that more flexibility would be appreciated, but that partnership has worked well in Ohio.
Well, thank you. And Mr. Chairman, I yield back.
Gentleman's time has expired. Now recognize the gentleman from Michigan, Mr. Kildee, for 5 minutes.
Thank you, Mr. Chairman, for recognizing me for holding today's hearing. This is a subject that I've spent a great deal of my career before coming to Congress working on, particularly in terms of federal investment and the way the federal government can support community and economic development. I mean, after all, the best way to provide for sustainable communities is to make sure that they have vibrant economies. And the federal government does have a role, can have a greater role, I think, in supporting that. Our states do rely on significant assistance from the federal government. The data that's been discussed in this committee makes that point very clear. But those state programs and state government's ability to be more stable allows states to invest in cities and towns as well. So reduced federal support has a cascading effect, not just on state budgets, but what we've seen is that states that are under fiscal stress tend to pass their stress on to local governments, which are creatures of state government. Add to that the reduction in the commitment that this federal government has made directly to community development through programs like, and Mr. Poloncarz, you mentioned the Community Development Block Grant Program. This is one of those programs where local priorities can drive funding decisions, but let's face it, I mean, we just haven't provided the support at a scale equal to the need in many of these communities. Those cuts in community development block grant support has a real impact on basic elements of civil society in chronically distressed communities. So perhaps Dr. Gordon and then Mr. Poloncarz, if you might discuss maybe in a little greater detail what you think the needs, CDBG being one way to address it, but in these left behind places, Dr. Gordon, that you referred to, these chronically distressed communities that seem to be immune to upcycles. There was a conversation about countercyclical investment. There are communities, a whole subset of American communities that are completely immune to upcycles. I happen to represent a string of those older industrial communities. I know you've all heard me talk about my hometown of Flint. It's the, I think the case study of what happens when we see chronic distress. Could you comment on where you think the federal government's role could be enhanced, each of you, particularly for these chronically distressed communities?
So I think the federal role is typically thought of as addressing these spillovers. So the congressman from New Jersey mentioned that you have bridges that connect states that people use every day to go from where they live to where they work. But there are also externalities from letting places fall behind. Not to mention that there is just a sense that as Americans, we want to provide a certain decent minimum for everyone, a certain level of access to goods that are necessary to live a healthy and productive life. So the federal government has a role in helping these places that are facing chronic challenges that come from things like trade and external economic events. One point that I tried to make in my testimony is that the federal government has an arsenal really at its disposal already in the $700 billion that it spends annually in federal grants, and that those grants could be better targeted to places that are in need. There have been experimentation during natural disasters, during economic disasters, to tweak these formulas to make them more responsive to differences in local need, in local cost, and local fiscal capacity. In my own work, I found that most states face a gap in what they could raise in revenues and what they would have to provide in spending to meet national benchmarks. Federal governments offset those gaps in about half of all states, but gaps remain in many, many states. And so from my perspective, I think the federal government should look at the tools that it already has and try to use them more effectively.
Poloncarz, you play a role in your community similar to one that I once played. I wonder if you might comment on the effect for your communities, but also the other places that you're familiar with around the state that may be facing chronic distress.
Well, the problem with chronic distress, Congressman, is it is chronic because you have just a never-ending cycle. You lose businesses, you lose tax base, you lose jobs, people move. what ends up happening, you still have the same need for the people that are left in the community, but you have less revenue now to pay for it on the local level. And we see that in large urban centers like the city of Buffalo, which has seen a tremendous revival, but depending on how you quantify it, it may be still considered the third or fourth poorest city in America. And then the same thing in rural communities where I talk to town supervisors, and they have some of the same issues and same problems. And on an annual basis, our consortium comes together to determine how we're going to spend community development block grants, and it's never enough. And we're then basically thinking, okay, what did we do last year? What did we do 2 years? Because we helped that community out 3 years ago. We helped this community out 2 years ago. Now who can we help out this year so that it's fair, but everyone sits at the table and just says we could do so much more if we had additional expenditure or additional revenue to assist us in those projects. And it really matters in a community where they cannot generate more revenue because they have a declining population and a declining tax base.
Thank you all very much, and I yield back.
The gentleman's time has expired. I now recognize the gentleman from South Carolina, Mr. Norman, for 5 minutes.
Thank each of you for coming here. Let me mention one thing about the jobs numbers that I saw up there. I had a constituent call me back during the Obama years and was questioning me on the jobs now versus jobs created then. And so I delved into it. The jobs created then, the difference was it was government jobs. It was for more bureaucracy. What this president has done is create private sector jobs. Ask any business. They will tell you they're investing in their business, they're putting equity in, they're excited. And it's from cuts in regulations, not expanding regulations. That's one of the main differences. For every one being proposed, this president is cutting 15 to 20. He's a businessman. Secondly, I would like to say that one thing both sides can agree on is infrastructure. Roads, streets, bridges. The issue is, and Mark, you mentioned it, is the money is never enough. You can't have enough money. And which comes to my question for each of you. I'm a contractor. I'm from the private sector. I've seen firsthand where with the same contractor, him charging $400 per square foot for pavers, he charging me $110. And he was making money at $110. I said, explain this to me. He said, it's government. What checks and balances can we put in place so that the block grants that you support, the money will go further and that it will not be taken advantage of? And I'll start, Doctor, with you.
Yeah. Oh, sorry. Which doctor? I think since the beginning of time, governors have come to Washington and said that what we really need is more money or the same amount of money with fewer strings attached. And from the federal government's perspective, of course, you want to limit budget exposure and you want to have restrictions on gaming and manipulating the system. I would just argue that there's a cost. As an economist, we're always talking about trade-offs. And so some of these maintenance of effort requirements, matching requirements, reporting requirements, basically, inhibit states from innovating and also might get in the way of the aims of the program in the first place.
Let me tell you what cured it in the situation that I just gave you. Competition. We got contractors from out of South Carolina that were willing to come in here. You had such a difference. Competition is where you have the dollars go further. And I think both sides can agree that's a good thing. Doctor?
And I would just add, that's what we have been doing in the state of Maine. We work hard on competitive procurement to make sure that we are really trying to look out to see who can do it best, highest quality for a good price. But I would note that we should look hard at the regulations that have been coming out recently, because while there may be fewer of them, they're oftentimes limiting state options. For example, 2 regulations this year for the SNAP program would limit state choices. In the state of Maine, we would have to conform to standard utility allowances that are more national. That would mean a 14% cut in our state that has high utility costs because of heating in the northern part of the state. We would have limited eligibility in what's called broad-based categorical eligibility. 44,000 people in Maine could lose eligibility because state flexibility is taken away. And I mentioned this Medicaid financial accountability regulation. That would affect all states' flexibility about how they have over years funded their state programs and pay for their hospitals. So I think we ought to be precise when we talk about regulatory burden. There may be fewer regs, but some of the regs that we're seeing would actually go backwards in terms of supporting states.
And this is what I would ask you to do. You put a balance sheet. put on the things that the regulation's supposed to provide versus why you think it's not there. And also, each one of y'all are at a good vantage point to offer cuts as well as things that needed to be changed. And nothing lasts forever. Our family budgets, business budgets are modified every 30 days. So to have things in place that aren't sunsetted makes no sense to me. Mark?
Certainly agree with a number of your points. One of the things that we have, especially when it comes to transportation, that is implemented in every project, are requests for proposals and taking the lowest responsible bidder. I've seen the bids come in and scratch my head and see how they're so out of numbers, but then you go with the lowest responsible bidder. It works in certain areas, it may not work in other areas. For example, in the Medicaid program, we know that there's many more people who are now on the program. In Erie County alone, it's approximately 80,000 more since the Affordable Care Act. But we haven't seen an increase in some of the dollar values associated with the age groups, because it's the individuals 65 and older and end-of-life care and nursing care that are driving the costs associated with it. And when you have a country, so to speak, where we're trying to make people live longer, we've been able to reduce the costs and ensure that we're providing health care for youths and families. But when we see this dramatic increase in cost with the individuals for end-of-life care and nursing care, at the same time the number of the enrollees goes down, I'm not certain how we control that aspect of it, because we all want to live longer lives.
Transparency. One of the big things is transparency, and having a gatekeeper that has no interest in it going up or down, that knows the system. That's the best way that I know to do it. Larry?
Gentleman's time is, go ahead and finish the question.
Just a quick comment. What the states need to do is still have accountability with the spending of the money, and hopefully, and not hopefully, when we should have more savings up front to offset the costs that might be incurred on the end where you have the accountability.
Gentleman's time has expired. Now recognize the gentleman from Nevada, Mr. Horsford, for 5 minutes.
Thank you very much, Mr. Chairman, for holding this hearing to discuss the important topic of federal investments and what they mean for our states. As we await the President's fiscal year 2021 budget blueprint, it's important for us to remind the President of all the good that federal investments bring to our states and local communities, its families and workers. Nevada is one of the few states that meets every other year in our legislature and is on a part-time schedule. So it's important that we have budget certainty, and that includes certainty for what money we receive from the federal government. Like many of the experts on the panel and some of my colleagues, I previously served in the state legislature and was the Senate Majority Leader not so long ago. And it was during the time when we faced our state's worst budget crisis during the Great Recession. We actually lost nearly a third of our state's revenue. Nevada's budget deficit, as I said, was one of the worst in the nation. Our unemployment and home foreclosure rates were among the country's highest. Fortunately, the Obama administration signed into law the American Recovery and Reinvestment Act of 2009, which provided $1.5 billion in direct aid, including funding for our schools, for states that met maintenance of effort, as well as Medicaid assistance, as well as other competitive grants that collectively created and saved nearly 34,000 jobs in my state. Today, we are one of the strongest economies in the nation, with record job growth since 2010, including small business creation, especially for women of color, and an increased housing appreciation. Additionally, Medicaid expansion in 2014 provided new life to so many Nevadans. Nevada was one of the first states to expand Medicaid under the Affordable Care Act, and I give credit where credit was due. I had the opportunity to work with then Republican Governor Brian Sandoval. He was the first Republican governor in the country to enact Medicaid expansion. From that, we now have 630,000 Nevadans currently on Medicaid, including children, pregnant women, seniors, and individuals with disabilities. And Nevada has increased Medicaid enrollment from 2013 to May of 2019 by 90%. We're second highest percentage increase in the U.S., second only to the chairman's great state of Kentucky. Well, despite all of these gains and the fact that we've been able to cut the rate of uninsured in our state, particularly among children, in half, under this administration, the president said when he was running for office, then candidate, there will be no cuts to Medicaid, quote unquote, in 2015. And long behold, he sent us a budget proposal last year that would have cut Medicaid spending by $1.5 trillion over 10 years. Nevada would have been one of the most hard-hit states as a result of that proposal, and I'm glad that this Congress rejected his budget blueprint and passed an alternative. Since I'm already familiar with how state and local governments are impacted by federal investments, and I believe that all of us should be arguing for more resources into our states, not less. I don't quite get my colleagues who want to get less money to their constituents for schools and healthcare and small businesses. I want to get my state share of the money that we send through taxpayer resources. So Dr. Gordon, can you explain to me how prepared are state and local governments for a possible recession in the future? How can the federal government help states and localities prepare? And all things go up. Our economy is good. I'm rooting for a good economy. I want successful small businesses and job growth. But we also know the trajectory, and we have to be prepared for when the economy is not as strong, and there are levers that the federal government can deploy. So can you speak to those, please? Thank you.
Yeah, I just want to say, of course, the recession does not appear to be imminent. However, states are very well prepared. Their rainy day balances are at an all-time high of 8% of general funds. As you know, credit rating agencies do various stress tests of state revenues and spending programs, and most states tend to pass those tests quite well. The issue is that states had healthy rainy day funds prior to the last recession, and nothing really could have prepared them for a revenue drop on the order of 30% and increasing demands for public programs. So it's great that the federal government stepped in and it did so quickly with the Recovery Act. What I'm concerned about is that we don't have an automatic response ready right now. We have to wait for discretionary action, and in fact, things that are done in the heat of the moment might not be the best policy.
The gentleman's time has expired. Now recognize the gentleman from Texas, Mr. Crenshaw, for 5 minutes.
Thank you, Mr. Chairman. Thank you, everyone, for being here. There's no debate over whether or not there should be federal support to the states. It might be framed that way sometimes, but that's not the debate. The debate is over how efficient it is and how sustainable it is, and what makes sense at the state level and what makes sense at the federal level, and that there should always be a debate about that. There was a question proposed of why wouldn't we always ask for more money for our constituents? Well, the reason is because we want to be good stewards of all taxpayer dollars, and we want a system that is actually sustainable. Sustainability is certainly a goal. Of course, I ask for money for my constituents, but I also know that my constituents voted to pass a $2.5 billion flood bond paid for by their own tax dollars. If I'm going to ask for flood mitigation funding from the federal government, and you bet that I have, then I know that we also need to match it. And there has to be a good relationship between the state and the federal government. There has to be a balance. The notion of flexibility has come up quite often, and that seems to be some bipartisan agreement there. So I want to ask for some examples from everyone on what kind of federal give me some examples on federal mandates that have either cost your state more, prevented innovation, or reduced efficiency. And we'll start with the ma'am from Ohio. Thank you.
Sure, thank you. I will go back to my last job prior to this was as the Chief Operating Officer for the Ohio Attorney General's office when Governor DeWine was Attorney General. And an example that frustrated me in that role was that we were continuing to receive federal grants for marijuana eradication when we were having Ohioans killed by the opiate crisis. And we didn't have the flexibility to redirect those funds. Wow. So I think that's a great example. There was a question earlier about if we have flexibility, how can we have accountability? I think the best accountability is to focus on results. And in Ohio, we're achieving results. We created 10,000 new private sector jobs this year. Small businesses are growing. The majority of the folks working with our small businesses right now are actually women creating small businesses for the first time ever in Ohio. We're seeing more venture capital investments. Innovation is up, and we created a new opportunity zone tax credit in Ohio that mirrors the federal opportunity zone so that we can drive more funding into those areas. So those are some of the things that we're doing.
Since we're on Ohio, we had problems in Texas with disaster relief funding being mired in a lot of red tape. Do you have the same issues in Ohio?
We absolutely do. Congressman, one of the things that I have on my whiteboard in my office as issues to address is the complexity of disaster recovery funds. We had some tornadoes in Ohio coming through the Dayton area earlier this year.
Has there been any official proposals by Ohio? In Texas, we had a long land commissioner's report on that.
We don't have any official proposals yet, but it is
Send them our way
issue.
if you
Absolutely,
develop
we
one.
will. Thank you.
And the rest of the panel, please answer the question. Thank you.
I don't have a lot of experience in this area. The most recent one are the floods that occurred in Arkansas.
It doesn't have to be disaster relief related. We're still on just general examples.
Generally speaking, when you're working with the Corps of Engineers and FEMA, they already have these rules and regulations that are in law that make it difficult to secure dollars in assistance. Now, we're working through that. I will, on the other hand, when we were going through this difficult time this year, they were there giving us advice and assistance in that way, looking at the levies, looking at the compromising of the levies. So they played a great part, but from a financial side, it's a long-term process to get money for levies when it comes to the federal government.
Thank you.
Congressman Crenshaw, I think your original question was with regards to federal mandates cost having more. Well, it's not so much it's costing more, it's sometimes the complexity associated with in the timeline delays. We do the best that we can to implement policies, but we're often dealing with knowing that we're not going to get funds for 3-4 years out, even though they sometimes are needed immediately. So I don't know if it's so much driving increased costs, at least at the local level in my county and upstate New York counties, but it's knowing that we could always, the programs are such that we're dependent on the funding, and often the funding for the projects that we need them for, whether community development block grants, clean water programs, or so forth, aren't going to come for years.
Thank you. I'm out of time. I yield back. Thank you, Mr. Chairman.
Thank you. Gentleman's time has expired. Now recognize the gentleman from Massachusetts, the Vice Chair of the committee, Mr. Moulton. Sorry about that. Off my game here. I recognize the gentleman from California, Mr. Panetta.
No. Always on your game, especially being from Kentucky. Thank you, Mr. Chair. I appreciate that. And ladies and gentlemen, thank you for this opportunity for us to talk to you and for your participation as well as your preparation in being here. My name is Jimmy Panetta. I come from the Central Coast of California. And as you have probably heard and as you know, California pays more in federal taxes than they receive in federal spending. Actually, 30.7% of our state's budget comes from federal funds. Now, obviously, California being as large as it is, population-wise, geography, as well as the economy, I think that's understandable. However, we do rely quite a bit on federal funding for the basics, be it transportation, be it environmental infrastructure, be it healthcare, be it education, and of course, emergency services and disaster response. Yet, despite the importance of supporting state and local governments, I think what we're seeing is that this administration has pursued policies that have sort of left them out to dry. With the 2017 tax bill, with the proposal of numerous budgets that cut this type of funding, as well as the investments. Looking at the 2017 tax law's cap on state and local tax deduction, it does create challenges for state revenue agencies facing pressure to provide relief for taxpayers, and the president's budget would have devastated state investments. Now, I am proud that the House at least addressed and passed legislation to repeal the SALT cap, and I'm also very proud that we continue to pass appropriations that do reflect our priorities, all of our priorities, Democrats and Republicans. But I do believe there is more that we can do. We should provide, as you've heard over and over, we should provide more certainty to our state governments by passing our appropriations bills on time. And we in this committee should be passing our own fiscally responsible budget resolutions instead of simply reacting to this administration's proposals for austerity. In this way, I do believe that we can ensure both our federal and state tax dollars are being spent efficiently and responsibly. Now, as a member of the Ways and Means Committee, as well as the Budget Committee, we examined the impacts of the 2017 tax law, and we specifically examined that what I mentioned, that cap on the state and local tax deduction. We heard from a number of witnesses from municipalities and emergency service providers about the harm that that tax does, concerned that it could harm investment at the local level. Now, Dr. Gordon, and I apologize if you have answered this before, and I was out at another hearing, but why would this be the case in regards to the potential damages that it could provide?
So the state and local tax deduction, like any deduction that's tied to marginal tax rates, was one of those deductions that was upside down, that benefited people more at the high end of the income distribution who faced higher tax rates. The cap addressed that inequity, however, at a cost, which is basically providing less of a subsidy to states to provide services to low-income people who live in the same state as those high-income people. So I think we have to remember that state and local governments spend about 2/3 of their budgets on healthcare and education, goods that the federal government and federal taxpayers feel are important. There's also a concern that limiting the SALT deduction basically makes it even harder for people who live in high-cost areas like the Silicon Valley or like New York City that are very productive and have higher salaries and higher wages that are nominally higher but don't buy as much in terms of actual rent and things that you need to survive. The federal tax code doesn't really take that into account, as you know. So the SALT deduction was one way of equalizing those differences.
Got it. Thank you. And now moving on to another issue that's important to me, biennial budgeting. And I know there was a question asked from my colleagues on the other side of the aisle, but just again, Dr. Merniques, what benefits have you experienced from biennial budgeting in Ohio? And what challenges as well have you experienced?
Congressman, biennial budgeting in Ohio is a longstanding tradition, and it is required in our state. We find that that enables us to plan ahead. We forecast our revenues well in advance. We plan our programs well in advance. It provides opportunity and certainty around when we're having the discussions about the budget so that it's all on a schedule and we can, we can keep to that. It's, I think, most important for our local partners that they know when programs are put in place that they will be there for the duration of that biennial budget time.
Great. I'm out of time. Thank you. I yield back, Mr. Chairman.
Gentleman's time has expired. I now recognize the gentleman from Oklahoma, Mr. Hearn, for 5 minutes.
Thank you, Mr. Chairman. I always love it when we talk about the Tax Cut and Jobs Act because it's a bit of schizophrenia we have because we talk about how it benefits the rich and poor, or the rich over the poor, and then when we talk about SALT, we talk about it only helped the higher wage earners, which by classification would be the richer. And so it's always amazing when I hear this, and I always hear the complaints from really two states, New York and California, who have taxed their local citizens into oblivion through state taxes, and then are critical of the federal government wanting to not have the rest of the country pay for those differences. But all that aside, we'll also have it this year the highest income revenue to the federal government in the history of the country, even by putting back $1.9 trillion of taxpayer dollars back into each individual's hands across America over the next decade. And it's always amazing to me when we hear about putting money back in the pockets of people, the individuals in each of your states and all the other states not represented here today, that's a bad thing. It's always been a bad thing. I just got into Congress about 14 months ago. It's always been a bad thing when somehow we've reduced revenue flows to the federal government. It's always been amazing to me. It's amazing to people who are not in Washington, D.C. The only people who are really critical of that are the people in Washington, D.C. But here we are today, and thanks to the president and his getting after the regulations and cutting somewhere around 10 to 15 regulations for everyone that's introduced. The growth is going on. I always hear my colleagues talk, and they're great friends, but they always talk about it could, it may, it possibly could. All these things that were talked about by really smart economists never came to fruition. And it's really this ideology that we're going to take all this money back to the states, and each of you are accountable to revenues, either in a county or a city or a state. I assure you, your people that get these monies back don't go bury them in the backyard, which is the only way they would take them out of the revenue streams in your communities. Because they do buy things in your communities, they do support your schools, they do support your roads, and they just support it directly without coming to Washington, D.C. and cutting off a layer of administrative fees, which is what happens so much up here. We've seen the growth in jobs, the greatest growth rate, lowest unemployment, the best employment of every group of citizens of the United States that like we've never seen in none of our lifetimes. And I spent 30 years of my life in Arkansas, grew up there in Russellville. I'm really appreciative of what's going on over there. Obviously, I live in Oklahoma, and now we're envying a lot of things you all are doing, which I think that's awesome. The president's talk about transportation infrastructure. He's met with the leaders. Still we're trying to figure out how to fund this. I believe it's a constitutional duty that we have to fund our infrastructure. Most great civilizations have collapsed because they couldn't maintain their infrastructure. And we've got a lot of work to do there. But like I said to some really smart economists that had really fancy degrees behind their names not too long ago, and also to Fed Chairman Powell, we've got to get a lot more Americans to work, producing a lot more revenue to the states, and that's what this president pleaded to do, and his campaign has done that. Promises made, promises kept. The facts show it out, regardless of how much you dislike him or hate him. That's not an impeachable offense, but yet we're trying to run it away because we don't like all this growth. So, for some reason. But I do have a question, and as we look at this, we continue to do this inequities to the American people of continuing resolution, omnibuses, something that most people never understand in their life. As a business guy for 35 years prior to getting up here, I thought this couldn't possibly be this hard. You heard every person here today, I'm sure, talk about how budgets were easy to pass, but the leadership would never get those into law. Since 1996, even though it's required by law, we just changed the rules. So can you just tell me, and I'll start with my friend from Arkansas, can you tell me what continuing resolutions do for you as a state director of finance?
Well, like Ohio, we budget on a two-year basis, two-year cycle, and so there is uncertainty that's added into each year, especially that second year, whenever you're doing the budget. So that's the main thing, the uncertainty, and it's helpful to know how much money you're going to get on the next year.
So to be completely bipartisan or nonpartisan, my colleague from New York, or my friend from New York there, if you could talk about what CRs do to you.
Well, they're no fun to deal with because we then put in contingency plans with regards to programs that we know are federally funded.
So can I just halt you there? I only get 20 seconds left, and I just want to be for the record that I've got a person from New York and a person from Arkansas agreeing, and we talk about how bad it is, and it should really be frustrating to you all sitting at that table and everybody that's going to watch this video across C-SPAN and elsewhere, that everybody in America, most people in America that are decision makers, hate CRs. Members of Congress hate CRs, yet we do them every single year because that's the only way the leadership can get together to make things work. We have to stop this ridiculousness. We got to do it in regular order, get a budget passed, be responsible legislators for the American people. I yield back.
Gentleman's time has expired. I now recognize the gentleman from Massachusetts, the vice chair of the committee, Mr. Moulton.
Mr. Hearn, I think we all want growth. We just don't want Russia running the country. Mr. Chairman, in fiscal year 2020, Democrats fought to protect Medicaid appropriations after President Trump suggested reducing Medicaid funding by $1.5 trillion over 10 years. At the same time, the 2017 Republican tax law, which benefits wealthier Americans and corporations, added $1.9 trillion over 10 years to the debt. The effect might be even greater after accounting for federal tax revenue being lost over CBO's projections as we experienced in 2019. Now, every member here on both sides of the aisle represents communities that count on federal dollars. There is bipartisan dependence on federal funds. In fact, my colleague Mr. Roy recently commented that states and communities should solve their own problems and not count on the federal government, which is ironic because he took home more federal funds in fiscal year 2019 for his district than every other Republican on this committee, by a factor of 2. But let's be clear, we all benefit from federal dollars, but one party is responsible for sinking us into a fiscal black hole by passing a tax cut for the wealthy and corporations that is completely unpaid for. The result, we experienced the largest deficit in American history last year. In fact, Republicans controlled the House, Senate, and White House during appropriations for fiscal years 2018 and 2019, and the deficit rose each year. According to the U.S. Treasury, the deficit increased in fiscal year 2019 to $984 billion, which is a 26% increase from the previous year and a 48% increase since fiscal year 2017, which is the last year of appropriations under the Obama administration. Now, the debt that comes from these repeated deficits is a massive bill that our kids and our grandkids will have to pay. It's like passing your family house down to your kids when the home is on fire, and taking out multiple mortgages so there's no value left in it, and with no insurance policy to pay for the loss. It's intergenerational theft. And here's the problem for today's hearing. Nobody on this committee, including my Republican friends and even the fiscal hawks like Mr. Roy among us, has volunteered to give up federal funds for his or her district. But we're running out of money. The math doesn't add up. Dr. Gordon, what fiscal challenges might state and local governments face if we cut federal government investments in states and local communities because of this massive Republican deficit?
It's interesting that you started with the federal budget's own challenges, because I would say in the long term, those are the same challenges facing states and localities. Aging of the population, uncertain and most likely rising healthcare costs. The GAO recently calculated that states will face a gap between revenues and expenditures on the order of 6% in 2068. So that's quite a ways out, but I think illustrates the fact that all of these governments are in the same boat together. And so I think the important question is figuring out which level of government is best situated to bear which kinds of risk, which levels of government should provide which kinds of services, and getting that sorted out before these sort of external threats come to play.
Mr. Polenkars, the low-income energy assistance program became law under President Reagan, who was no friend of taxes, to protect millions of low-income households each year from extreme heat and cold when high energy bills exceed their ability to pay for them. In President Trump's last budget proposal, he eliminated this program. Now, I understand that, much like my district, your county gets rather cold in the winter, and residents rely on this program to keep their homes warm. What measures would you need to take if federal investment for this program disappeared?
Well, we'd immediately have to find a way to invest a few $1 million that we did not originally budget for. And remember, my budget is on a calendar year, January to December. So if it actually changed in the middle of the year and I'm looking at the fall and the winter coming up, I'd have to find millions of dollars that I'd be able to put into it, because as you note, even with climate change, where it's been a little warmer in our community on and off, and this winter, it's supposed to get really cold again, down to 10 degrees. And if you don't have heat, your pipes burst, you die. It's a lifeline for tens of thousands, including working individuals who rely on heat to help pay for their energy costs, and without it, it would be devastating.
And is it going to be easy to find those millions of dollars?
No. We'd either have to go into our reserves, our piggy bank, which we've slowly developed over time, or we'd have to raise taxes, which would probably not be acceptable in most situations, even if you're talking about ensuring that someone has heat. A lot of my legislators that I deal with are so adverse to the idea of raising taxes that they would rather let some people go cold than raise their taxes on others.
Thank you. Thank you, Mr. Chairman.
Gentleman's time has expired. Now recognize the gentlelady from Texas, Ms. Jackson Lee, for 5 minutes.
Mr. Chairman, Ranking Member, let me thank you for this very important hearing. I started my service, civic and governmental service, as a municipal court judge and as a member of the Houston City Council And I always say that's where the rubber hits the road. I have great respect for state government, federal government, but it is where these dollars really have a strong impact. I want to take note of the fact that we had a declining debt, 2016, the end of the Obama administration at $14.2 trillion, and we now have at the end of 2019 and growing a debt of $16.7 trillion. In those numbers, unfortunately, we have an administration who seeks to find ways to impact or to cover up that debt by cutting, I think, vital services. So let me try to be as succinct, and if your answers can be succinct, I'd appreciate it. Dr. Gordon, what is the economic rationale for federal grants to states?
The rationale is to address spillovers, things that are benefits or costs that a state might not take into account when it's making a determination. And some of those spillovers include concerns of equity or fairness, or providing the things that we think are important for people for a healthy and productive life.
Do you, I come from the region of Hurricane Harvey. I remember having to introduce a bill for $174 billion. We are still trying to recover. And I also call the federal government the umbrella in a rainy day. That may be the fire hose in a fire, it may be the relief engine in a tornado. How does that impact what the federal government has to do for states and local governments?
Thank you for pointing that out. It's often said that all states except one are bound by balanced budget requirements. Actually, the truth is a little bit murkier than that. And it turns out that even states that don't have balanced budget requirements do balance their books each year. So the fact that the federal government can borrow in extreme circumstances, or maybe not so extreme circumstances, is important because it's better situated to absorb risks, whether from a natural disaster or an economic shock.
And we have experienced natural disasters. As I said, we're still suffering. Commissioner Lambrou, I certainly work with my county government, and one of the opportunities or responsibilities of county government is, of course, the health construct, the health system. This administration, unfortunately, has been using various efforts at undermining Medicare and Social Security, but particularly Medicaid, with this whole concept of block granting. Tell us what would happen if Medicaid is sizably diminished for the vulnerable people in your county.
I mean, in the state of Maine, we certainly would experience problems, not just, and I think it's important to recognize, the proposal in the budget is not just to cap Medicaid as a block grant, is to cut it. And I think that those cuts represent significant proportions of people. It could be that we couldn't provide the services to older Mainers or children the way we do now. It would mean benefits that would have to be scaled back. We've been trying to, again, tackle the opioid epidemic and provide residential treatment for mothers with children to make sure that their family stays together while that parent gets substance use disorder. We've been trying to get at social factors or determinants of health. How do we make sure we're providing the nutritional support for food security, housing support?
So cuts, block granting and/or cuts in Medicaid will be devastating to local government and your local government in particular.
Yes.
Let me, County Executive Policarts, do I have it almost correct, sir?
That's good.
You can correct it in any way you desire. But let me indicate that one of the blows of this economy now is the major tax cut, which the administration insisted on giving a corporate tax cut that even corporations did not ask for. Almost 5 points down, as I understand it, which has been ludicrous in terms of dollars for the Treasury. Can you let me know, one of the other aspects that we work a lot with the county government or state government is transportation infrastructure, which water falls under that, the whole issue of climate change and environmental quality, even though in an EPA. What do you believe is the importance of the federal government collaboration with some of these quality of life issues, certainly transportation, and when those dollars are cut, how does it impact you?
Well, it has an incredible impact. As I noted earlier, Erie County has a road infrastructure that's actually greater than length than 3 states. And as such, if we did not receive federal assistance from the federal government to actually provide additional money to do these road projects, we would just continue to have problems. And when you live in an area like Buffalo in upstate New York, when you put roads down, they don't last 50 years. You've got freeze thaws, sometimes multiples in a year. And so if you can get 15 years out of a road, that's a good thing. And if we were to go out there and to try to replace our 2,400 lane miles of county roads every 10, 15 years, it would be very difficult on our own. We'd not be able to do it without coming up with some other revenue source to pay for it or cutting the other services that exist.
As I yield back, Mr. Chairman, I just want to say these are Americans who are speaking. They're speaking for Americans, though they're located across the nation. This $16.7 trillion debt that's growing is hurting Americans. This tax cut is hurting Americans, and this potential war with Iran will hurt Americans. I yield back.
Gentlelady's time has expired, and now yield 10 minutes to the ranking member, Mr. Womack.
I'll try not to take all that time because I know we have votes that are scheduled and will be coming up here perhaps even as I speak. I want to thank the panel for being here. I never miss an opportunity to brag on my home state, and I'm going to do that today with Secretary Walther. Not lost on me is the fact that his chief of staff is in the audience today, my friend Alan McVeigh. Alan, always good to see you. Appreciate the work that you do and have done. He's been a member of the Economic Development Forces of Arkansas for a long, long time and doing great work up at DFNA. The current, we've had this discussion that has come up in this in the last couple of hours about the broken budget process. I never miss an opportunity to talk about this process because, as the Chairman noted a minute ago, we spent all of 2018 investing our time in trying to fix this broken budget and appropriations process cycle without ultimate success, but we did create a lot of ideas that are even today being explored by the Congress, and I hope they come to fruition at some point in time. So let's talk about what we do in Arkansas. Two-year budget. Larry, it is a balanced budget by constitutional provision and gives you the opportunity to provide certainty while at the same time protect yourself against some unforeseen circumstance that might happen in the biennium. Is that correct?
Yes, sir, it is. As I mentioned in my testimony, we also build in safeguards where we prioritize the spending, and if revenues don't come in as expected, then the lowest priority gets taken off the table, and then the next, and then the next. And that's happened in the the recession of 2008 and 9. There was significant cuts. We even cut into A at one time. So that's the way we do it. Now, another aspect of our biennial approach is we still have a session every year. This year, we're going to have a session starts in April, and it's called the fiscal session. The only thing we talk about are the budget and the fiscal requirements of the state. And if there's some need to make adjustments in our budget at that time or in increases for services that weren't expected, we can make changes at that point in time.
If you didn't have a responsibility to balance your budget, it would make the need for a biennial session less important to you, would it not?
That's correct. As I've heard the testimony today, the need or the requirement of having a balanced budget and no deficit and no debt leaves me with no choice but to make adjustments if something happens. If a major change happened in federal money that would require the state to supplement more or to provide more to education or Medicaid, most of those are set. About 90% of my budget is fixed. In other words, I don't have any choice. I've got to spend the money. And so we would have to make really difficult decisions on those other services that are out there that you have education, you have Medicaid, you have corrections. Sometimes we don't talk about that, but we've got to deal with that aspect of our budget, and it's predictable, but it's not going down either, so as I think most states know.
Necessitated by your process, our process, you it's incumbent on the General Assembly, the elected leaders that come from all of our cities and our counties, to make some tough decisions from time to time. Is that correct?
That's correct, and we have a wide diversity in our legislature, both in the House and Senate, so they bring urban issues there, they bring rural issues, and so that's where they come together in committees to hash out these issues. I'll appear before them, my staff appears before them to give them certain information having to do with the cost of the decisions they have before them, and that's a major portion or input into the decision-making process is what does it cost and what do you have to do in order to spend that money.
Director Murnix, it works for the state of Arkansas. It works for the state of Ohio. Why wouldn't or shouldn't it work for the U.S. federal government?
Ranking Member Womack, I would say that it works and you should try it.
We'll have that conversation among us, I'm sure, sometime in the not-too-distant future. I'm going to give everybody on the panel an opportunity to give us words of wisdom from out in the lands of where the rubber meets the road, because that's where you guys come from. If you had a recommendation, one recommendation that you could make to your federal government that would better accomplish the objectives that were set out in this hearing today to kind of expose that federal-state relationship, bind it a little better without just throwing a lot more money at it, given the fiscal condition, this is the caveat, okay? We're $1 trillion deficit this year, $23 trillion in debt. Given the fiscal condition of our country, what recommendation would you make to this body or to the Congress of the United States that would, shall we say, make things better for all Americans? We'll start with you, Dr. Gordon.
To the extent that there have been jurisdictions that are in trouble, I think the federal government has looked at expediting the flow of funds that are already appropriated or obligated. In the cases that I'm familiar with, it has been difficult to figure out where the bottlenecks are in terms of local jurisdictions actually spending federal funds. That seems tremendously important to me as a management tool. If you had some kind of indicators of where there were basically uncashed checks, as happened in Detroit, for example, then the federal government could perhaps be more responsive and provide technical assistance or other kinds of help before it becomes a bankruptcy, as in the case of Detroit. So my very nerdy, wonky prescription is a better fiscal data architecture for the federal government. It strikes me as crazy that any company, to use that analogy, can tell you what its offices in various parts of the country are spending at any given point in time. I'm not sure the federal government can do that on a dime. It can do it, but it requires a lot of digging. So better data in real time on expenditures from federal funds.
Better data architecture. I would agree with you there, and there are many examples in the federal government where we don't have a really good data architecture. At least that data is not being shared and utilized for great purposes. All right, Dr. Lambrou, yours.
Maintaining the partnerships that we have at the federal and state level, which is when we think through Medicaid and these programs where you have to plan significantly far out. Not knowing if that relationship is going to be the same is probably more of a problem for us than a CR, because at least a CR is the same. But worrying about, will the rules change? Will we be able to do supplemental payments to our hospitals? Will we be able to raise taxes the way we've done that? That is in play right now with executive branch rulemaking. I think that Congress being more engaged with our executive branch to make sure that they're being good partners with states would be a valuable thing.
Okay, Mr. Pollenkrantz.
It's almost the old do no harm. I'm not always necessarily coming in here with hat in hand saying, give me more, we could do more. But if some of the recent budgets that have been proposed by the administration had been passed as is, it would be a tremendous impact. And there's no part in some ways of our county government that doesn't be touched by the federal government, from Medicaid, TANF, to even the Army Corps of Engineers helping us design a fish ladder for a dam so that we don't have invasive species going up a creek. So I would just say do no harm and understand that we're here to help and work with you as much as possible.
Secretary Walther.
I'm going to come at it from a little different approach. It would seem to me, and I've had my last two assignments in Washington, D.C. were, I was the director of U.S. Trade and Development Agency, and I was also on the board of Ex-Im Bank. And both of those agencies are designed to promote exports from the United States to foreign countries. And at the XM Bank, it's a bipartisan board, and I was a minority board member. But we worked outstandingly together because we were going in the same direction. Our objective was to make companies in the United States better prepared for exporting and to finance those exports. It's bipartisan. What would help from Arkansas, what people sometimes call flyover country, would be if our legislature, the Congress, and the administration were on the same page as it relates to these sorts of issues. And set the policy and then move forward. But you have to do it together. That's a tough hill.
Director Murnix?
Yes, I would concur with the comments about a better data infrastructure. And actually in Ohio, we're implementing a new project called Innovate Ohio that's focused on just that. I would say looking at the long term, instead of focusing on short-term accomplishments, look at the long-term vision and focus on long-term results. Governor DeWine likes to say, the seeds we plant today, we may not see the trees that they produce during our lifetime, but we know that those investments matter. And so we're focused on children, and we're focused on how we can improve their lives. I would say more flexibility in how we go about achieving those results, reducing regulations, following some of the examples like what we have implemented in Ohio with reducing the number of regulations each time we adopt new, and also looking at the business and economic impacts on all of our new regulations.
My compliments to the panel. Thank you very much for joining us today, and we could utilize a lot of this wisdom and put it to work for the betterment of the American people. I thank you.
I thank the ranking member. I now yield myself 10 minutes for questioning. And I think it's really astounding that there was no one anywhere in this room today that denied that federal funds at the state and local level are really critical. And that's a starting point, I think. What we do have some question about is the issues of flexibility and strings. And I was a young staffer up here, very, very young, many years ago during the Nixon administration. And the first job I had, the first assignment I had, I was working for a Republican senator from Kentucky, and my first real assignment was to write a speech supporting a program called revenue sharing, which the Nixon administration was putting forth. And under revenue sharing, they took a huge chunk of money and just gave it to states and cities and towns. And no strings attached. The only string, as I recall, and my history may be a little shaky, was that the public had to be engaged in the decision as to how to spend the money. But there really wasn't any accountability after that. The program went on until 1986. It was canceled under the Reagan administration, largely because the deficits were getting higher and higher, and there wasn't enough money to continue doing that. They needed the money for, Reagan was trying to build up the military at that point and a variety of other things. Population was getting older. But that's kind of the extreme we're looking at. Just give the money back, use it for whatever you want. I haven't heard that kind of a proposal recently. Dr. Gordon, you've addressed this in various ways during the course of the hearing, but in a general sense, to the extent that we want some degree of flexibility, I'll stipulate that, although that's dangerous, but I'll stipulate we want some degree of flexibility and we want some degree of accountability. What should be the goals of the flexibility and the accountability?
I think that is the question. And actually, my reading of the history on general revenue sharing is, yes, there was that great quote from, I think, James Baker, that there was no more revenue left to share. But also, if you look at the funding formula, there were internal contradictions where they included a term that was supposed to represent a community's need or need for federal revenue, and also its own revenue-raising effort. So basically, you had many different expectations all wrapped up into this one program, as well as the state versus local component, and it was just sort of unrealistic to expect it to bear all those expectations. So yes, I've tried to say a couple of times that I do think there needs to be a balance in terms of flexibility and accountability. States actually experiment with this on their own vis-a-vis grants to local governments. So there might be something to look at there in terms of specific program design.
Thank you. And I want to talk about flexibility with regard to Medicaid specifically, because Director Murnix, that you talked about this, and all the waivers that are out there, and we've had that experience in Kentucky as well. In our last administration, the governor asked for a lot of waivers, wanted to impose work requirements and those types of things. And it occurs to me that while a certain level of flexibility may or may not be useful with Medicaid, but you run the risk with a waiver system of creating, maybe without intention, maybe with intention, a reduction in care. You're going to be, work requirements, for instance, will reduce, and by the governor's own admission, when he submitted the waiver in Kentucky, it was 95,000 people, under his own estimate, that were going to lose care. Is that not a risk when you're asking for, at least if you're talking about, from our perspective, wanting to provide health care for people who need it most? Is that not a risk that with waivers you could end up with, again, either malevolently or not, a reduction in care?
Mr. Chairman, I believe that when we're talking about flexibility, we're talking about more than waivers. We're talking about actual flexibility to implement programs on the ground in the best ways that they work for our constituents. We think that our states and our local jurisdictions are those that are closest to the problems that Ohioans and our local communities are facing, and they're at the best place to make decisions about the way to assist them to achieve their American dream. And I would say that in Ohio, an example of how we have been able to bring different resources together, different states and federal funds, can provide an example of that, but we have had to do that through achieving a lot of waivers and a lot of paperwork. And that if flexibility were the rule instead of the exception, that would make it much easier for us to help the citizens of Ohio.
So can you give me an example of something you were trying to do that became problematic because of the lack of flexibility within Medicaid, for instance?
I would say that when we are looking at the different, as we're redefining the Medicaid program in Ohio, we're looking at the managed care system and what when we are re-procuring that, what it can look like. And how can we encourage those dollars to provide better health outcomes? How can we structure the system so that it is focused on the health of all Ohioans and wellness? And as we are examining that, it's extremely complicated. The regulations are quite onerous, and it takes a great amount of time. And I would say that there aren't that many people throughout the system that understand when you push one lever, the impact that it has on the rest. So again, just being able to help states with fewer regulations so that we can structure our programs in the way that, in the case of Medicaid, it is focused on wellness instead of just the regulations of the system.
I appreciate that. Dr. Lambrew, would you address that? You obviously are very familiar with Medicaid in Maine.
I am, and we have been actively exploring all the options that we have within our Maine Care Medicaid program to do better by the people of Maine. We haven't hit that many barriers with like one good exception. We talked earlier about housing and the affordability of housing being a problem. If a person's homeless, they can't necessarily take their medications, see their doctors, they have transportation problems. There are things outside the boundaries of the healthcare system that affect health. I think Medicaid rules have limited the ability for Medicaid funding to go outside those bounds. That's about accountability, and I appreciate that. But going to your earlier example, I think we sometimes confuse flexibility with program integrity. The state innovation waivers that are in effect for different parts of the law with the Affordable Care Act put guardrails on what could be approved for a waiver, and I think they're interesting, right? 4 conditions, not complicated. To do a waiver, you have to cover as many people with as affordable coverage, as comprehensive coverage, with no increase to the federal budget. right? That's 4 simple guardrails, and if a state can do it better, they can. So that's the sort of guardrails I think we all should think about when we talk about flexibility. Can states do it better? In many cases, yes. But so long as they maintain that program integrity, what is the program meant to do? I think that's a way for federal government to guide states.
Well, I think that, I think it was Mr. Norman was talking about, you don't want to waste money, you don't want to, and you don't want to impose requirements that are not going to serve any purpose. And I think one of the problems we have up here is we rarely do oversight to see what regulations, after they've been in place for a while, make sense and which don't make sense anymore, which are providing a public benefit and which aren't. But that's another thing we need to talk about. Ranking member and I'll figure that out next week. But I'm going to surrender the rest of my time and thank the witnesses very much for your time and wisdom and your appearance. And if there's no other business before the committee, the hearing is adjourned.